like to call this meeting to order and ask the clerk to take the roll.
Supervisor Foy. Here. Supervisor Parks. Here. Supervisor Long.
Here.
Supervisor Zaragoza.
Here.
And Supervisor Bennett.
Here. And before we go to our Pledge of Allegiance, I just think it's appropriate that we congratulate the right half of the dais here. Mr. Berg, Foy, and Parks all have passed the filing deadline test, right? And I'm sure are very relieved here this week, right, as things go forward. So congratulations to all three of you. Really appreciate it. And so why don't we have Mr. Berg, in commemoration of that, do our Pledge of Allegiance here.
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, the minutes of March 4th, we need a motion. It's been moved and seconded. We're ready to vote. Okay. And that passes 4 yeses, 1 abstention. Supervisor Long was gone from the meeting last week. Agenda review, Mr. Powers.
Thank you, Chair Bennett. Just a couple items. Item 28, Healthcare Agency Behavioral Health, approval of the mental health triage personnel grant application. There's a revised board letter which has been submitted, distributed, and posted. Also on that item 28, the agenda title was updated due to the revised board letter to change the number of full-time equivalent behavioral health clinician 3s from 8 to 4, and to add 4 crisis team clinicians, and change psychiatric technician to mental health associate licensed. On item 32, addendum agenda, time certain, 9 o'clock, CEO's office, public hearing regarding adoption of the 2014 to 2017 memorandum of agreement with the Ventura County Deputy Sheriff's Association. The agenda, page 2, was updated to change the title only to reflect the correct term of 2014 to 2017. And that's it.
Great. And that addendum is going to be at 9 o'clock for the benefit of the public. Right? All right. Do we have any other modifications to the agenda? All right. With that, we entertain a motion to approve the agenda as modified. It's been moved and seconded. We're ready to vote. And that passes. Board members and members of the audience, I think you're going to really enjoy this, particularly as note that we probably have a lot of IHSS workers out there. And this is Caregivers organization that's going to be doing our Moment of Inspiration, and they really specialize in trying to get volunteers to help people stay in their homes. It is an organization that is having their 30th anniversary. They were one of the original ones in the country, and of those original ones that have launched, and not all of them made it, and there certainly one of the most successful ones in the country is right here. And so it's a real pleasure for me to introduce Tammy Glenn, and this is truly an inspirational organization when you go and see the volunteers that are there working for that. And Tammy, welcome here this morning, and thank you for taking the time to come down.
Thank you so much, Supervisor Bennett, and distinguished members of the board, for having Caregivers, volunteers assisting the elderly, here today. This is part of a year-long celebration for our 30th anniversary. And I am joined today by members of our board of directors and some of our major corporate supporters who are here today, and my staff to celebrate. And thanks to the vision of the Sisters of St. Joseph of Carondelet and the Robert Wood Johnson Foundation, Caregivers, Volunteers Assisting the Elderly was founded in 1984. We were one of the original pilot programs in the nation for volunteer caregiving. And out of this idea 30 years ago has come a national movement in volunteer caregiving that is really starting to sweep the nation. And there are 600 organizations like us that have survived over the years, and we're helping to lead and foster new ones all over the country, from Hawaii to DC to Alaska to Texas and Florida, everywhere. Our main mission is to match a volunteer in the community who donates about 2 to 4 hours a week of neighborly deeds to a senior who is isolated and frail. They probably don't have family living nearby, or they may not have family at all. And so our volunteers step in, and some of the relationships we've introduced have gone back 20 years. That's how successful this has been. And I can give you lots and lots of examples of relationships that go back 10, 15, and new ones that we're forming every day. Today we have pushing 400 volunteers I saw in our quarterly report, and I'm waiting, anticipating the moment when we tip 600 seniors that we're serving. We currently serve 6 cities in Ventura County. We serve Ventura, Oxnard, Fillmore, Santa Paula, Camarillo, and Port Hueneme. And thanks to this model, we're doing a really good community-based service. So this happens thanks to a lot of good volunteer support, but it's solely driven by private support. There's about 4% of our funding that comes from public monies. And most recently, we've had some corporate supporters that have really stepped up, and they represent close to $75,000 in annual funding. So today we're joined by representatives from Amgen, Haas Foundation, and Kaiser Permanente Foundation. And thank you, thank you, thank you. We could not do this without you. We really could not. And in particular, I'll point out Kaiser has been helping us fund access to health care. Amgen, I just want to note, has been funding caregivers for 20 years and probably close to $200,000 in funding over the years. And Haas Automation stepped up recently, and they are funding our Building Bridges intergenerational program. This is an after-school high school program. We now have more than 400 alumni over the years that have gone through this program, and those young adults are now coming back into the program after they graduate college, and they are volunteering one-on-one with seniors. That just started happening this last summer. So, and that is the portion of the program that Haas Automation funds. So thank you, thank you. And thanks for celebrating our 30th anniversary. We have events going on all year long. The community's really stepped up. We have museums and different venues through a program called A Wrinkle in Time. And in fact, we kicked off here at the Government Center January 31st, and Supervisor Bennett was here to celebrate with us. And we'll be going all year and 30 years more after this.
Well, Tammy, thank you very much. You know, could you tell us real quickly how many were the original chapters back in 1984?
Originally, there were 25 pilot programs funded in 1984 across the country. Today, 16 of those have survived. So our caregivers here in Ventura County is absolutely one of the strongest. We are a leader. We serve on the National Volunteer Caregiving Network Board of Directors, and we're helping to grow others like us now.
You know, and I say it oftentimes that you can measure a community by how well it takes care of its defenseless. And I think all of us over and over again are proud of so many things that Ventura County's been leaders in. This is one of those. As a result of caregivers, we can say in Ventura County, our elderly who are alone and don't have families have somebody from the community who checks in on them. And that's just something that we ought to all be proud of, just as we're proud of the IHSS work that is done back there by those people. So thank you for making us all more proud. And I hope you'll pass that on to your volunteers. And we have certificates for Haas and Kaiser and Amgen, and if we could have the representatives come down, and we'd like to be able to take your picture, and if there's anything that any of the three of you would like to say about your participation in this, we'd sure appreciate that also.
Well, I just want to thank all of you for the kind recognition, but it's really our pleasure and honor for Kaiser Permanente to support such a wonderful, worthwhile organization that really cares for the most vulnerable, fragile members of our community, and we're just very happy to have this opportunity to make sure that we're supporting a great organization. Thank you.
Good morning. Also from Haas Automation, the Gene Haas Foundation, I'd just like to congratulate you on your 30 years. It is inspirational, and it's uplifting, and very important, and it will become even more important in our future as our population's aging. So thank you very much. We're very happy to support you. Thank you.
Thank you.
Mr. Chair, I would also like to thank, all the contributors, Haas Automation, Permanente, Tammy, and all the caregivers for all the good work that they do for family members, for grandfathers, for the mothers, for the children, and people that you take care of. It's a tough job, and I just want to thank them for doing an excellent job, and thank all the contributors for helping out. And what is it, 30 years of an anniversary. And thank you again for the good work that you do for the community. Thank you.
I too would like to thank the contributors, Haas and Amgen and Kaiser for this. But also, if people want to volunteer, how can they contact you? Is there a phone number or a way they can get a hold of you?
Absolutely. We're always looking for volunteers, and please, check out our website. Our website address is www.vc, like Ventura County, caregivers with an S, .org. That's vccaregivers.org. And our phone number, give us a call. We'll bring you into the office and tell you all about us. Our number is 805-658-8530. That's 805-658-8530. Thank you, Supervisor
Thank
Parks.
you. Thank you so much for what you do.
Two men bracket it and the women on the inside. Here we go. Let's bring you with this here. And you come over here on this side. So hands down in the middle. That's it. There we go. Okay, we're now at our public comment portion of our agenda, and we have,
Your consent, sir.
I'm sorry, the consent agenda. We need a motion for the consent agenda. Thank you. Been moved and seconded. We're ready to vote. That passes. Thank you. We now are at public comments, and we have 5 speakers? I only have 4 listed on my thing here. Can you tell me what's... Well, while he's working that out, let's have our first speaker here for comments, and that's Juana Mendez. Good morning, Ms. Mendez.
Buenos días, señores supervisores. Mi nombre es Juana Méndez y yo soy un proveedor de IHSS por 7 años. Yo me ocupo de 2 personas que necesitan de la atención debido a su edad y condiciones de salud. Yo estoy aquí para pedir...
Do you want to translate?
Yo estoy aquí para pedir a los supervisores que apoyen nuestra propuesta de salario para los trabajadores de
Can-
IHSS. No hemos recibido un aumento desde el 2007, todo es más caro ahora. Un aumento significaría que mi familia y yo podamos
Ah,
pagar nuestras utilidades de primera
Señora.
necesidad como son.
Señora, ¿no tiene alguien que nos pueda ayudar a traducir de los participantes? Maybe Marisela can help us out.
Anybody willing to
Marisela
translate?
can. Oh,
Okay, thank you.
okay, Juan can do it.
¿Puedo comenzar otra vez?
Espera un momento para que. Okay. Comienzo otra vez.
Sí,
Sí.
sí, from the beginning.
Mi nombre es Juana Méndez, yo soy proveedora de IHSS por 7 años y me
Ok.
ocupo de 2 personas.
¿Cómo se llama?
Juana Méndez, ujú.
Her name is Juana Mendez. She's a long time working for this company. Long time care
por 7 años.
for 7 years.
Y me ocupo de 2 personas que necesitan atención debido a su edad y condición de salud.
She's in charge of 2 people that needs her help or their condition of health.
Estoy aquí para pedir a los supervisores del condado que nos den su apoyo para la propuesta salarial para los trabajadores de IHSS.
She's here to put her attempt to get a raise for the workers,
Ask for a
salary
raise,
workers.
No hemos recibido un aumento desde el 2007 y ahora la vida es más cara.
We haven't received a raise since 2007. Now life is more expensive.
Un aumento significaría que mi familia y yo podamos pagar nuestras utilidades de primera necesidad.
A raise will provide us a way of living to pay our utilities and
De primera necesidad.
first necessity
Como
utilities,
es el agua, la luz, la electricidad, el gas
the water, the electricity, gas,
y la gasolina para nuestro carro, que es muy necesario cuando llevamos a las personas a sus citas médicas.
and gasoline for the cars when we take the people to their appointments, to medical appointments.
Algunas personas tienen sus citas en Thousand Oaks, por ejemplo, yo vivo en Santa Paula
Some persons have their appointments in Thousand Oaks. For example, I live in Santa Paula.
y en nuestras responsabilidades es llevarlas. Ellas no saben cómo, si nosotros tenemos para la gasolina o no. Ellos no están obligados a darnos ni un centavo, es nuestra responsabilidad. Entonces la gasolina en estos tiempos está muy cara.
It's our responsibility to take them to their appointments. At the present moment, gasoline is too expensive.
Así es de que pido por favor una decisión de apoyar a nuestro aumento salarial.
Therefore, we ask for you guys to agree to a raise on the salaries.
Que nos ayudaría a 3,200 trabajadores de atención domiciliaria.
It will help 3,200 employees for attention to the address of the needed people,
Y 4,000 consumidores.
and 4,000 consumers.
Entonces, yo por favor les pido pensar sobre el beneficio que sería más para los consumidores, más que para nosotros, porque a veces nosotros tenemos otras oportunidades de otro trabajo, pero en cambio ellos no tienen muchas opciones, algunos están completamente sin familia, ellos necesitan atención. Entonces,
Therefore, we
muchas
ask you to
gracias.
consider this because they're in need of these services. She thanks you guys for the opportunity to speak.
Muchas gracias.
Thank you.
Gracias.
Thank you both. Thank you for your testimony, and sir, thank you very much for translating for us.
name's
Appreciate it. Our next speaker is Chuck Brown. Good morning, Mr. Brown.
Good morning. Good morning, County Supervisors. My name is Chuck Brown. I've been an IHSS provider for several years now. I take care of my wife and my daughter. I'm here today to ask the supervisors to support a raise for the IHSS workers. And I wanted to tell you how I became an IHSS worker. I had a very successful plumbing business, Chuck Brown Plumbing. was a 24-hour service business that I owned and operated for over 30 years. My wife was a nurse, and life was great. We have 4 kids. My youngest daughter, at the age of 14, we discovered she had systemic lupus and rheumatoid arthritis. So my wife and I discussed how we're going to handle this because she could hardly even move at the time. She has these flare-ups, and sometimes it's very difficult for her to even get out of bed. So we decided, my wife decided to retire from the nursing career and I'd keep my plumbing business, and she stayed home and take care of our daughter. A year and a half later, my wife contracted a virus. She got congestive heart disease, and then she had a stroke at the age of 45. So I had to sell my business. I love my family, and I'm going to take care of them. So I sold my business, and that's what I do, is I take care of my family now. I tell you, living off $9.50 an hour from what we had is really tough. It's not easy. I saw the realities of life, and it wasn't very easy. It's been about 6 years on that same pay. So a raise would really help pay rent now, utilities, food, and try to raise the quality of life for my family as it is. I have worked with the union to express my opinions, and I know that the last time they had an official session with collective bargaining was February 6th. And there hasn't been any time set since then. 1 month may not seem like a long time in the bargaining world, but for me, another 4 weeks of struggling, another 4 weeks of not being able to provide the essential basic needs of my family that we need to survive, it's important. So I ask the supervisors of Ventura County to please support our wage increase, not just for my family, but we have 3,000 other IHSS providers, and it would really help them along. The cost of living is raising, and it's getting higher and higher. I urge that they speed the process along. If we could just get it sped up a little bit. We need a stable workforce. You know, we're not going anywhere. We're going to take care of our family. It's not like the fast food service where you can change over work all the time. So we need the stability there for us. So I urge you to please speed the process. Thank you very much.
Thank you for your testimony, Mr. Brown, and thank you for taking care of your family members.
Thank you.
We really appreciate it. Danny Carrillo. Good morning, Mr. Carrillo.
Morning. Morning, Mr. Chair, members of the board. My name is Danny Carrillo with SEIU Local 721. I'm here today in support of our brothers and sisters who are members of our sister local ULTCW. As you heard and acknowledged in the past, the hard work that these people perform day in and day out, and not just for family members, but to assist a segment of our population here in this county that cannot be forgotten, those with special needs and disabilities. As is the case in other parts of the state and country, these providers here are often primarily women and women of color. Like so many of workers today, they continue to make sacrifices that not only benefit their clients, but our communities as well, by keeping costs down for all taxpayers and keeping clients out of costly nursing homes. Fortunately, the economy is slowly returning with revenues up, allowing employers to do the right thing by approving contracts that contain some financial gains. It is time for these providers to be shown some equity for the work and services they provide. Keep in mind, these providers and households pay taxes also. It is time to show your appreciation by approving a better economic package to them that will only be realized by our communities by the greater purchasing power that they will have. I'm sure you have heard reports and studies that show raising hourly rates for the lower income workers will help local spending and returning those dollars back to businesses, thus increasing tax revenues. And all will stand to realize a better way of life. So supervisors, as a representative of working people, trying to help the workers get the respect and dignity that we all deserve, it is time to do the right thing for these providers by working to improve not only their financial position, but one that we can all benefit from. Please don't forget the 99%. Thank you.
Thank you for your testimony, Mr. Carrillo. Marcela Morales. Good morning, Ms. Morales.
see, we have 5 minutes now. I hadn't prepared for 5 minutes. Good morning, Chair and members of the board. My name is Marisela Morales, and I'm co-executive director of CAUSE. CAUSE began actually as the Ventura County Living Wage Coalition back in 1997. And it was in 2001 that the final vote came before the County Board of Supervisors with regards to the first ever living wage ordinance here in our region, the Ventura County Living Wage Ordinance. At that time, in the final hour, the IHSS workers were specifically excluded from the living wage ordinance in 2001. The theory was that when the employer of record was established, that was in process at the time, that their wages would be addressed. And the expectation, at least on our part, was that they would receive at least, at a minimum, a living wage. It is now 13 years since the county living wage ordinance was adopted, and we believe it's high time for IHSS workers to receive at least a living wage. As you've heard, the IHSS workers have not received a raise since 2007, and the cost of living has gone up, pushing them closer and closer to the poverty line. Many of them are women, but you've also heard testimony from fathers, husbands. They are heads of households, and they're trying to make ends meet while they do the compassionate care of caring for families or other members of our community. Just last year in 2013, the County of Santa Barbara, also after many, many years, finally increased the IHSS worker wages. They were already at $10 an hour. And as of February of this year, their wages increased to $11.05. And in 2015, it will go up to $11.35. In your packet, you have a copy from the California Budget Project, and it is a breakdown of the cost of living for Ventura County as well as for Santa Barbara County by way of comparison. Surprisingly, Ventura County cost of living is actually higher than that of Santa Barbara County. So an increase for IHSS workers in Santa Barbara County certainly is a good model to follow for Ventura County. We urge the County Board of Supervisors to increase the wages of IHSS workers in our county to at least a living wage rate. A living wage for IHSS workers provides financial stability for these workers to continue their compassionate work day in and day out. And a living wage for IHSS workers is cost effective to taxpayers by keeping these vulnerable children and elderly and disabled in their homes instead of in institutionalized care. Thank you so much.
Thank you for your testimony, Ms. Morales, and thank you for CAUSE's efforts on behalf of these people. Next speaker is Maria Wallace. Good morning, Ms. Wallace.
Good morning. My name is Maria Wallace. I became part of the in-home services about 10 years ago. I have a son who's 16. I have a daughter who's 18 and a 6-year-old. The one who was affected was the 16-year-old. He is Fragile X, severely mentally disabled. He has a tumor in the brain. He's unable to speak, unable to bathe himself, and unable to feed himself or even be by himself. My life has been a struggle. I was married 22 years till finally we're getting divorced. My house went into foreclosure in 2011. We were able to save it. The finances has really affected and impacted my family. What I receive from in-home services has been great, but not enough. My daughter's graduating from prom. She's graduating from high school, going to prom, and the expenses are so much. I didn't realize that. That the older they get, the more expensive they can. When you go to the movies, if you can't afford your ticket, it's sad. Because they got a 6-year-old who wants to see Frozen. He can't afford it. I used to shop at Costco when, things were good. $350. I think that's average when you go to Costco. But when you have to choose, you have to go to the 99-cent store so you can afford everything else. I'm very proud of my kids. I am privileged to be their parent. And I'll do whatever it takes to become better every day. I learn from them every day. But I'm here to support in-home services because I'm very proud to be part of it. Everyone is a hero. Everyone who struggles every day. And you know, when you take care of someone who's disabled, you have to give it all, whether it's an elderly person or a child. Many people tell me, my son has no cancer, so you should be happy. There's no difference with a terminal ill. He also has a tumor. So every day is a struggle. Every day I give thanks to the Lord for what I have. I would like for all of you to know that what they make is not much. And they're not asking that much for what they give. We give a lot. I know in my family, I give it all. More than 100%. You can't give 20, 40, 50, even 90. Or even, you have to go beyond. Because you have to leave all your worries on the side and take care of that one person that most needs you. That's, in my case, all three of them, but mostly one more than the other. So I can't worry about finances. But I do when I go and buy groceries, and I have to put it back because I can only afford $150 to buy groceries, and if it's over that, I have to put it back. And that's what I go through every day. Every day. Even at the 99-cent store becomes sometimes a little bit over my budget. I have to look around for coupons, shopping. It becomes a struggle every day, especially with a 6-year-old. When you go to a store, you know, they want toys. You can't afford it. The economy has taken a toll on all of us. Everything has gone up. Everything. I mean, putting all of that on the side, you know, these families have struggled and they done their job. Help us to have that $2 increase. I think we have earned it. So, thank you, and these are all heroes. So they care for it, and they give it all to someone that needs it. Thank you.
Ms. Wallace, thank you very much for your testimony, and thank you very much for taking care of your son.
It's my pleasure. It's my privilege to be his parent. Thank you.
And you and Mr. Brown and the other people here have certainly demonstrated the dignity that you possess and that you give to all of us by taking care of all of these people here in Ventura County. So on behalf of the board, to all of the IHSS workers, the last 2 weeks you certainly have presented compelling testimony about what your situation is and what you're doing for all of us. So thank you very much.
Oh, thank you for all being here and listening to us. Thank you.
Thank you.
And Mr. Chair, as I mentioned before, thank you so much again, all of you, for the good work that you do for taking care of your families. Thank you, Maria, for the testimony.
I'd just like to add thank you, too, for putting a face on who you are and what you do. When IHSS was established by the state, it was clearly done to be that, step into that gap that was present in our communities and that safety net. I expect everyone up here knows that no one's getting rich off of the IHSS program. What you do to work with your loved ones and support your loved ones, and as was said, to keep them out of nursing homes, if there's a nursing home available, which that's the other side of the, another part of the issue. But what you do is both very important and as a family and supporting your family, and as a community and supporting our community. So thank you for that, and thank you for coming here and putting that face on what you do. It's appreciated. Thank you.
Thank you very much. We really appreciate it. That concludes our public comments. Mr. Powers, you look like you got your light on.
Yeah, thank you, Chair Bennett. Just a comment, and again, as we said last week, thank you for your testimony here today and for the important work you do for those most in need in our community. Wanted you to know, too, that in between meetings, our labor team, led by Mr. Cosio, is meeting with your labor team to work on the issues in your proposal and has spent the time also evaluating your request for an increase. And I believe the next meeting is this Monday, and they'll have a proposal for you then. So, again, thank you.
Okay. Thank you very much. We're now ready for board comments, and Supervisor Zaragoza.
Yes, thank you so much, supervisors. You know, we are now going into our fourth meeting with the Listos. Listos is a program that we put together to get ready for a disaster, for an earthquake, for tsunami. Hope we don't, but to get our folks ready. And we're having meetings over in Colonia, over at Cesar Chavez School, every Tuesday. And this is the fourth meeting that we're having, and we're having 4 of 6. And it's working out pretty good, where the individuals are learning, as I mentioned before, where the gas meter is, where the water faucet is to turn the water in case of a flood, and also to learn where the electrical panel is in case of a disaster. So that's working out pretty good. Also had the opportunity last Thursday to support the Seroptimists and they stopped the human trafficking march, and I participated then with the Debbie and some of the Seroptimists that were here the other day. And also made a presentation to the Lindenwood Neighborhood Council meeting last Thursday, and it was well attended, and we gave some information on what we're doing here in the county and our budget and so forth. And Juan, you know, the individual that was so grateful to give us interpretation in Spanish, was there, and I thank you, Juan, for participating in his neighborhood. He's very active in that Lindenwood neighborhood. And also want to thank Joe Avalar, who is the chairperson of that neighborhood and also the chairperson of the INCF. The INCF in Oxnard is a group of all the presidents of the different neighborhoods that meet together once a month to share information and take that information to their city council. So it was a great opportunity to speak to those individuals last Thursday. And of course, then I'd like to adjourn in memory of those individuals on this list.
Great.
Thank you.
Thank you very much. And as was pointed out to me by Supervisor Parks, we do have our 9 o'clock time certain items, so we'll hold Supervisor Foy. You'll be on deck for board comments, but let's go ahead and go to our 9 o'clock time certain items. So to the CEO's office.
Thank you for your time. Thank you.
Thank you.
Oh, there she is. Sorry.
Good morning, Chair, Supervisor Steve Bennett, honorable members of the board, CEO Powers. For the record, my name is Catherine Rodriguez, Assistant CEO and Labor Relations Director. The item before you today is a recommendation for your board to commence public hearings on the adoption of the Memorandum of Agreement between the County of Ventura and Ventura County Deputy Sheriff's Association. The agreement will be placed also on March 18, 2014, agenda for a second hearing and a final adoption. The proposed 3-year term agreement was ratified by VCDSA membership on March 7, 2014. The negotiations started in September 3, 2013, These negotiation sessions were very informative and productive in achieving a fair deal that both satisfied the interests of the union, our employees, and our taxpayers. We also want to acknowledge, first and foremost, the sacrifices from our employees in not receiving general salary increases since April 2010. And on top of that, a reduction of 2.5% increase in their pay, in that we have increased their retirement contribution in June. The proposed agreement is approximately $8.6 million for the 3-year term, which is approximately 2.06 as annualized. The exhibits for the highlights of the VCDSA contract and the red line MOU is attached with the board item. With that, I'd like to walk you through and illustrate how and the highlights of this contract.
Do you want me to? Okay. Thank you, Ms. Rodriguez, board members. So just to summarize overall the elements of the agreement, and then Ms. Rodriguez will go through the details. As you heard, of course, very important, I know, for your board and all of us to have competitive salaries and benefits for our deputy sheriffs to maintain the high quality of office and department that we have. You had also wanted us to achieve pension reform, and one of the key things that this agreement does is achieve a full 50-50 cost sharing of normal costs. And to be clear about this, we all know that the state passed pension reform known as PEPRA, and there was some confusion of this, but that state law did not require this to happen. It made it facilitated in labor negotiations, but it never required 50-50 cost sharing for current employees, and yet this agreement does achieve that. We'll touch on PEPRA in just a moment. The agreement also achieves several overtime and cost savings, the annual leave reduction of redeemable hours, and reducing of the gross up that is provided for that. That also is consistent with the agreements also reached with the other labor tables as well as with our managers. And then you'll see details about changes to the form for calculating compensatory time off and overtime related to Fair Labor Standards Act requirements. And then finally, this also improves transparency in two ways. One, it shows that now county employees are picking up their portion of their contribution, and that has been offset and put into their salaries, so their compensation structure has been made more transparent. And then finally, the new compensation surveys, the way we're doing it now, will include the employer contribution for retirement. And again, that is a new way of doing the surveys. To put this back in context, your board, when we started labor negotiations about a year and a half or so ago, wanted to achieve several items of pension reform, including limits to base pay, caps on pensions. During that time, of course, your board was also calling for a statewide solution to pension issues, and that is, in fact, exactly what happened with the adoption of the PEPRA Act. And this is to just summarize the impacts of PEPRA. First of all, it applies to new employees, and there are three major areas. On compensation earnable, it limits that final compensation to base pay. That includes aspects including the educational incentive, annual leave redemption, and so forth, which had a very significant impact. You recall there was an issue with that with our retirement association, where your board adopted the more restrictive definition of base pay and excluding those items that are listed up there. PEPRA also established a cap on pensionable compensation, and you can see for safety members there that's not a cap on the actual pension amount. That's a cap on the amount that the formula is applied to, so it's even lower than that. Again, for new employees, what we'll call PEPRA employees, it establishes that 50-50 cost sharing. It does lower the formulas a little bit, although our formulas were already a little bit were on the lower side. And then it also calls for a 3-year averaging. Right now there's 1 year, and PEPRA calls for a 3-year averaging for safety members. I'm sorry, PEPRA stands for the Public Employees Pension Reform Act. Thank you, yes. And then just to set the stage here, there's going to be a good walkthrough by Ms. Rodriguez to try to understand all the terms of the agreement. It is a very complex agreement. There's a lot of moving parts to it. Your board had a lot of goals for achieving many improvements in the agreements. So that's going to take some time, and our hope is that it'll have an improved understanding of these elements. But even if there's some areas that are just so complex, it's going to be difficult, no matter how well I know Ms. Rodriguez is going to explain it. It will certainly give you a sense of the detail to which your board has undertaken to get into the issues and how these contracts, these very complex contracts, actually work. So, yes, ma'am.
When we have taken a more, as you say, conservative approach to what is limited to base pay
Right.
in comparison to the retirement board, which has I guess a more liberal policy, but we are bound by the retirement board's decision. Is that right? In terms of what is taken?
That is not our understanding. And we are not, and your board has set the policy that we are going to restrict it to the more limited definition of base pay, and that is what we're funding the retirement levels at for Vocera.
Okay. Thank you.
Ms. Rodriguez.
Thank you. Ensuring market competitiveness and with salaries and benefits, the agreement will provide the following. It will be a 3-year agreement that starts on March 18, 2014 and ends on February 28, 2017. On May 2, 2014, payment will be made for a one-time payment for full-time regular employees that are working 64 hours and above will receive a $750, and employees working from 40 to 64 hours will be paid $600. On March 1, 2015, a 1% cross...
Catherine, can I ask on that?
Yes.
I want to be careful that we understand that it was said to me, that's a signing bonus. I want to be careful we don't do that. We understood this was for everybody, not just in public safety. It's everybody who's worked so hard to help save us $30 million a year. Mr. Powers, would you agree?
Yes, thank you, Supervisor Foy. Yes, very much so. Just to clarify that, this is really a revenue sharing with our employees. Because of their good work and your board's good work, as you've seen at the end of the last several budget years, there's been fund balance and savings achieved, significant millions of dollars of savings achieved, and this is our way of expressing our appreciation to our employees for their good hard work.
Right, and a lot of that's been done in the Sheriff's Department. A lot of hard work's been done there too. So.
Thank you. And on March 1, 2015, a 1% across the board will be provided to the employees, and followed by a 3% increase on the following year on February 28, 2016. And also on March 1, 2015, a 1% market-based adjustment will be provided with an eligibility criteria if the total compensation is greater than 10% above market. And on March 30, 2014, for plan year 2014, a $312 increase of a total for the annual, or a $12 biweekly increase will be provided to help assist the employees with the increase in cost for the health premium cost for that plan year. And that means currently the employee pays $248. That would be increased to $260. And on December 7, 2014, that amount would then again be increased by an additional $12, which will be $260 to $272. For these purposes, only the part-time employees will be also eligible for this amount, to $12 biweekly, for those working from 40 hours to 60 hours, which would then be equating to from $184 to $196. And then the following year, they will be receiving $196 to $208. And on July 6, 2014, this one is the most complicated part of this negotiation, is on how to derive on the salary adjustments to offset the 50-50 cost sharing of retirement for normal cost rate. And finally, on November 11, 2014, in recognition for those armed forces that has served the United States, effective 11/11/2014, Veterans Day will be considered as a paid assigned holiday, provided that this holiday would also be pursued through a collective bargaining agreement with all of other unions. If in case that this item is not pursued by that time, then this will be deferred for the following year.
And if I just ask real quick, or just talk about, this as we talked about the one-time payment of $750, the flex credit, Veterans Day is something all employees across the county are participating in, right?
That's correct.
Okay.
As a background for the 50/50, I know it's a busy, busy slide. I'll try to slowly go through this. Dear God. As a background for the 50/50 cost sharing of the normal cost rate, I'd like to walk you through the safety's retirement contribution for an employee hired prior to June 2010. As the retirement plan funding is actually derived from three funds. One is coming from the employee contribution, the other is from the employer contribution, and the third is coming from the investment earnings net of admin costs. Those three funds are then are then collected together in order to come up with to cover the benefit payments. As a source, this chart is actually derived from the Viseras Actuarial Valuation and Review as of June 30, 2013, provided by Siegel Consulting on December 9, 2013 for fiscal year 2014-15. The green boxes or the green column is actually the required contribution, and then the blue will be the employer's contribution, which totals up to the total contribution from both funds. Currently, the employee for 2014-15, and this is based on the phased-in adjustment with the change in the assumptions of the market return on investment, currently employee pays 2.5%. The total required employee contribution is 13.4%. That means 10.9%, however, is being picked up by the employer. The employer contribution has 18.26%, and the unfunded liability is 36.28%, which totals the employer cost of 54.54%. However, because the employer is picking up this share, 10.9%, that increases the employer's contribution from 54.54 plus the 10.9 is 65.44%. So the total of all the total contribution for both is the 54 added to the 13.4% employee contribution is 67.94% total pension contribution, both from the employee and the employer. If we have to apply the 50/50 cost share, that would be the total of the normal cost rate. That would be the employee's share, which is a 13.4 and 18.26. Add them together, that's a 31.66, and then apply the 50% in that. So that would be approximately 15.83 if we have to apply it in this line. However, as proposed, we will be then eliminating the employer pickup. However, and require the employee to pay 15.37% or the 50/50 of their share. That comes up with the total normal cost is 31.82%, less 1.08% as an adjustment for the cost of cessation of member contributions after 30 years of service. These employees are still in their system, so therefore costs are still being incurred in a sense that they're still accumulating their years of service, and that factor is approximately 1.08%. So the 3182 minus the 30-year employees is 30.74%. So that 30.74% is split in two, 15.37% for the employee, and the employer is 15.37%. And then we have to add back the cost which will be burdened by the county for those 30-year employees, which comes up to about 16.45% for the employer for the normal costs. So we have the normal cost at 16.45 for the employer, and then the unfunded liability is 36.28, which totals to 52.73. So as you can see, the employee contribution increased from 13.4, though they're only contributing 2.5, now it's 15.37%. So the total of the cost, retirement contribution from both funds is 68.10%. The question will be, what is the 68.10%? Can I go to the next slide? Okay.
So the question is now it's 50/50 with a 15.37 for the employee and then the employer. Right?
Yes, that's the 50/50.
And how many do we have on the 30-year, for adjustment for the 30, how many employees do we have there? Any idea?
A number of them, approximately about 80, Supervisor.
About 80 out of
Yeah.
the 8,000 plus employees? Okay.
So the 68.10% earlier that was on the total contribution, that amount is then multiplied to our pensionable income. Pensionable income, as defined by Ventura decision, includes the base salary plus benefits paid in cash. And so therefore, that 6810 times the pensionable income is what we have to put it into our pension fund. Okay? Another busy slides. On the green column earlier, we have actually cited the employee contribution. The employee contribution, as I said, was that 13.4, 10.9% of which is being picked up by the employer or being paid by the employer. And now we're going to increase to achieve the 50/50 cost sharing to 1537. Therefore, there's an additional 1.97% that goes in, which was actually a part of the normal cost sharing currently being paid by the employer, which is now going to be shifted to the employee to achieve that 50/50. Okay. In order to achieve this 50/50 cost sharing, we have provided 14.15% as a salary increase. That is calculated as the 10.9%, which is going to the employee now of the retirement pickup, and then the 1.97%, which was the increase from the 13.4 to the 1537 is 1.97. So that's the 10.9 is 1287. And this amount, if we have a simple formula for the implementation process, would be multiplied to the base and the other benefits, which is the pensionable income. Because of the way that we're going to implement this, we're going to increase the base salary. So by increasing the base salary only, we have to account for some allowances for those fixed benefits that would not be increased because of that application. So therefore, the value for that adjustment for this fixed flat dollar benefits is approximately 1.28%. So added together, the 12.87% plus this premium or the offset to get them even to the increase in their cost sharing would be 14.15%.
Thank you, Chair. Just to clarify, on that 1.28 is really done to preserve the take-home pay. If you didn't do that, they'd have a reduction in their take-home.
That's correct, yes. So as you can see on there's also a disadvantage and the advantages of this this retirement cost 50/50 cost sharing. This 14-15%, because it's being included into the base pay, when we calculate overtime, this amount will also apply for some parts of the overtime. So therefore, there's going to be a cost as an incidental cost by doing this application or the implementation. However, because of the 50/50 cost sharing, now the employees are exposed to risks as in terms as when the market goes up because of the fluctuation of market, then the employees are now taking a share of that burden when the market goes down. Then going to one of the county initiatives that we have as consistent with the other groups that has been settled is the annual leave redemptions for the new hires effective March 18, 2014. The changes are right now the redeemable hours are actually will be paid at base hourly rate. Right now they're being paid at gross up, and gross up is defined as, per the contract, it meant you include your base salary at 100%, and then we will have to have some adjustments for the benefits such as these items, the educational incentive, the bilingual premium pay, the 30-year incentive, additional compensation for supervisors, and assignment pay. this in value is approximately 12 to 24%, depending on what the employee can be eligible for. So the gross up will then, the hourly rate will then be inflated by these benefits, which is 112 to 124%. This will be the value of that hourly rate when they redeem their annual leave. Oops, sorry. Another change is that we have reduced the number of redeemable hours from after 5 years of service, employees are entitled to get at least half of their balance or not to exceed 120 hours to 100 hours. And for those employees that are below 5 years, they are actually cashing out 80 hours. Along with that, we also have changed the frequency of redemption so that the redemption is done in a lower frequency from calendar year, from twice in a calendar year, so that if one employee cashes out in December, would turn around and also can cash out the following month, which is in January. So that would cause some spiking, but again, this is for new hires. It would not matter because it's for base the total compensation is based on the pensionable income is based on the base salary only.
Right. Let me just say that this was not a county issue or a sheriff issue. It's a retirement board issue because they only take the last trailing 12 months.
Correct.
So that's why the change is here. So, yeah, okay.
Now, because of these changes, the employee's estimated gross pay decreases by approximately $2,200 or 2.47% of their earnings. Another initiative is to go through the compensatory time off. The amendment for 1985 FLSA, Fair Labor Standards Act, allowed the state and local government to have the compensation for overtime in the form of paid time away from work, which is what we call the comp time or compensatory time off, CTO from now on. And so they have the options for the employee to at least be paid in cash when they have worked that overtime or defer that payment in the form of a CTO when they take it off. Because it's being deferred, this becomes to be a cost saver in that if they take it on the following year, at least for the current budget year, that would not be paid. So therefore, it becomes to be a deferred payment, but it could be argued also if it's a cost saver or not. And then the current conversion for this 1 hour of overtime, an employee for every 1 hour is converted to 1.5 hours of CTO. Because the amount is higher, the number of hours is higher, one would say that the use of CTO may result in overtime due to staff replacement when the employee takes off to fill that schedule. The changes that were made or being proposed are, one is to reduce the overtime conversion to CTO. Before was 12 hours, converted to 18 hours of CTO. This is just one shift, for instance. And our new MOA would then be from 12 hours convert to 12 hours. So that's a third of the hours that would be reduced. And that differential will be paid during that current pay period where it was earned in cash. Along with that, we also have reduced the maximum accrual from 480 hours to 360 hours. Because of these changes, from the reduction of the conversion and the reduction of the maximum accrual, it results into a decrease in overtime because of the fact that when an employee takes off and uses their CTO, a replacement for that shift will be done and it will be incurred in the form of overtime. Currently, the Sheriff's Office is incurring approximately 10,500 hours of overtime a year for the due to CTO. And converting that, if we decreased, so that's approximately 625,000 a year. So if we decrease the conversion by a third, approximately a third of the cost will also be saved by $203,000.
Okay. As you talk about the savings, the deputy's still getting paid. The 18 hours, he gets his 12 put into overtime, he gets paid out the 6. And what was happening before is he used some of that time as part of his time in. And so what you're talking about is that the sheriff now will have a boot on the ground for that 6 hours versus, is that what you're talking about, where the savings comes from for that 200, the overtime portion?
The saving is coming from actually, right now, they have 10,500 hours of overtime.
Because of the CTO.
Because of the CTL.
Right.
It's projected so that because of the conversion, it's lowering the ability to accumulate that balance. And also, along with the 480 to 360, it's projected that the 10,500 overtime, seeing that we have reduced the conversion by a third, that the overtime would also be reduced by a third of that. So the approximate amount is $625,000 for those 10,500 hours. So a third is $203,000. So this is just for the reduction in the overtime, slowing the growth of their accrual.
Okay.
This diagram reflects the worst case scenario whereby the conversion of overtime to CTO results to a possible progressive increase in overtime. I'll start with employee A, for instance, who worked 12 hours of overtime. Employee A opted to be paid in the form of CTO, so that converts to from 12 hours of overtime now to 18 hours of CTO. Then A then has the ability to take off and takes off 18 hours of CTO. Now, another employee, which will then fill that spot where when A takes off, will fill that spot. B, or a group of employees, will work 18 hours to fill A's shift. And then this group of employees decides to bank those overtime hours in the form of CTO. Because of the conversion, 18 hours then now multiplies to the 1.5 conversion rate, results to 27 hours. So then again, B takes off, this group of employees takes off at 27 hours as from their CTO, using their CTL. And the cycle goes on, and C, or group employees, works the 27 hours where the B people or B employee has taken off, and C will then fill those hours that B has vacated, and then C decides to again earn that into a CTO, so the 27 hours converts to 40.5. As you can see, the 12 hours that originally was taken because of this ability to bank their hours in form of CTO has now triggered an additional 18 hours of overtime plus an additional 27 or 45 hours of overtime. So that is the worst case scenario wherein there's a multiplying effect of this comp time off. Please note that because the sheriff's office has currently have policies and some limitations on their overtime. In order to mitigate this impact, they have these policies, and appropriate use, management assures that appropriate use of this overtime and the staffing level is maintained.
And if I might, Mr. Chair, and I think that's a key point. I think it was important in working with the sheriff as we work through all of this to allow certainly management to do the great job they do in managing the workforce and what the needs are, and to have the flexibility they need. So this chart, even as perhaps following it, is step by step by step. There was a whole lot of work put into this, and review, and discussions.
Yes.
Catherine, I think, as you said, this is kind of the worst case scenario, and the sheriff's offices and their senior leadership have tried to work to manage that so that we don't have that. I know you don't like to use the word, but it could be abuse. We don't, and they've managed that, so it's worked out. But what we saw in that was it could get out of control, and the sheriff has done that to control this kind of stuff. So I think that's good. But now it's even going to make it a little bit easier that we can do this. And those extra hours, instead of now I can bank 12 hours instead of 18, they get paid for it, so nobody's losing anything, which I think was a key for all of us to make sure all the deputies never took a pay hit on this thing. So that was good.
Yeah. So that if we, let's just say, for instance, apply our conversion into this model, then the 12 hours on B column, that would be 12. On the C column, it would be 12. So that, if in case the adjustments have broken down. Okay. So the next one is shifting the gear for the Fair Labor Standards Act of how the 14.15% increase in 50-50 cost sharing to overtime. What's the impact on this? So first of all, what is the FLSA overtime rate? It's defined that the rate is no less than 1.5% of the regular rate of pay of hours worked in excess of statutory standards. So the regular rate of pay and hours worked will be discussed. So hours worked for overtime includes all time an employee must be on duty or on the employer's premises or any other prescribed place of work. This excludes all paid and unpaid leave, such as the vacation, sick time, sick industrial leave, holiday and bereavement. As an example, to calculate that threshold for law enforcement, on a 12-hour shift, which is 2 weeks, and overtime is paid only if the hours work has exceeded 86 hours, or in a 1 week, convert that 43 hours worked. Now, for fire, for instance, on a 27-day cycle, their overtime is paid above 204 hours per FLSA standard. Now, the regular rate of pay or the premium for the overtime, FLSA has a standard for that, which includes, on the calculation for the premium, it includes the base pay plus the other benefits such as the post-certification, the flex credit, the patrol bonus, premium pay, and other benefits paid in cash. So the total of all this for the entire work period is divided by the number of hours worked, multiplied by 50%, and that would be applied for those hours above 86 on a 12-hour shift employee. However, our MOA has some provisions for overtime for hours work above 80 up through 86. It's more discount in the sense that FLSA has all this. Since this does not qualify as an OT on FLSA standard, an adjustment was made so that the overtime only includes the peace officer's standards training certificate. So that this is a lower amount as compared to this amount. And then that number is divided by 80 times 50%, and that would be applied between the hours of 80 to 86, or those non-FLSA hours. As an example, for instance, is we have a deputy sheriff earning $40.38. Going shortcut, the FLSA overtime rate for this employee is now at $63.13. With the 1415 of the base increase or the 50-50 offset, that will be increased by $8.57. And so therefore, with the new FLSA overtime rate will be increased by that amount of the 8.57 or the 14-15%. Now it's 71.70 cents. Our agreement, however, with VCDSA has $61.21 for those non-FLSA overtime. So it has a discount from the amount to lower that to $61.21, which is the amount that was derived earlier.
And that's the portion between the 80 and the 86 hours, right?
That's
those 6
correct.
extra hours.
The contract overtime.
Right, which you've got as a discounted down to even, yeah, okay. Right.
61.21, yes. So the 61.21 is in putting the values in that we have the base pay, which is the $40.38. You put the post incentive of $102 for that bi week, and then you take the premium of that, the total of the $3,332 divided by 80, and then multiply by 50% to get the premium. So that's how the 61.21. our new MOA will not count the 14.15% increase on their base pay toward contract OT. And that's the proposal. So in summary, the increases to overtime premium as a result of this increases, the regular rate of pay, or the 1% will be counted, the contract OT will get the 1% for general salary increase, and non-FLSA would get a general salary increase. And then the market-based adjustment will also be applied to the regular rate, the contract rate of pay, and the non-FLSA. However, for the 50-50 cost sharing, the contract rate and the non-FLSA overtime will not count the 14-15% amount in there. By doing so, we have estimated a cost savings annually of about $750,000. Had we not done that, then the cost would be that much higher. In order to achieve transparency, as Mike said earlier, that we have now instituted a new market-based study for total compensation. The compensation components now include a more comprehensive study of salaries and benefits, by now including all employer retirement contributions, which I have gone through earlier with all the, the 52% in there, and the 14-15% as an offset. So the base pay would be increased by 14%, and then the employer contribution, all of which will be counted into this market-based study. Before, our methodology included only the retirement pickup, which is only the 10.9%.
Ms. Rodriguez, could you go back one slide, please? I just want to try to point this out. I mean, there's so many things on here. The teacher in me just cries out to have a quiz on this when this is over with. But I do think this really merits pointing out. I mean, essentially, we're trying to accomplish something that nobody else has accomplished, getting to the 50-50 cost share, and giving the salary increase as a compensation for that. This was really a good faith effort and a good faith concession that the deputies were willing to make sure that that increase in overtime costs that would be associated with that did not hit in terms of the non-FLSA hours. And for most people don't know what that means, but that's what would be overtime that is credited that's less than the state mandated overtime criteria. And bottom line is, I think most people are not going to understand all that, but bottom line is the savings of $750,000 annually. And combined with some other savings, that's a substantial hit, about $1 million for the sheriff's budget. And I just think it should be pointed out that that's one of the things that made this, I think, a unique negotiation, that was a good faith effort on the part of the deputy sheriffs to say, okay, that's fair. We'll make this concession at this side of it and stuff. I think that was very helpful at the table. So I wanted to point that out. Well, most people are not going to understand this. There's basically a $750,000 give on the overtime that was made by the deputy sheriffs. That under normal circumstances, they would have been getting paid that. So thank you.
In summary, the proposed contract will provide reasonable increases and while achieving the 50-50 normal cost sharing. And because of that initiative that we did put in, it has also some savings in there. And finally, as Supervisor Bennett indicated, that there is actually a $750,000 increase plus the comp time, which is approximately $1 million. So thank you. I'll be happy to answer any questions.
Thank you very much.
Mr. Chair, one of the things too that maybe we need another bullet point there, that's future savings are tremendous too, and we want to thank the deputies for working with us, because that's really going to save the taxpayers and the sheriff's budget numerous dollars in the future too. That I think it's extremely important that the public understand that.
Yes.
All right.
Other comments? Supervisor Foy.
Catherine, I don't think you can get away without me making some comments. But first of all, let me say that I got to commend you, your staff, CEO's office. This has been, as I look, this has been a unbelievable adventure. Yes. Because I remember we'd said a couple of years back, we want to know every detail of every contract, or what's in the contract before we do something. And if I look at these books, Here's the first binder. And it's funny, this started back in 2000. It's 2/12/12. So it's and here's the other one. So you look at these, and there's thousands of pages of information. You guys have invested thousands of hours. We've invested hundreds of hours to truly understand what's gone into all of these contracts and all the different pieces and how they all relate. And for myself, I mean, when I first got here and we did our first contract, I got to tell you, I didn't understand all the pieces. Pieces weren't explained as well as they probably should have been to us. And I said, next time I want to know everything. And as a matter of fact, Catherine's been tremendous. She spent, I think it was, almost 12 hours personally with me in the last week going through detail after detail. And the sheriff himself jumped on the phone with us to give us some understanding. And it was good. So it's just been an unbelievable amount of time and effort put into really making all this work. And I think from our standpoint, I think the first thing that was said when we got into sheriff contract, because people would say, well, you've got 80 hours and then you've got this overtime for 6 hours. Why would we do that? And we'd looked at it and said, look, that's just part of their pay. It's just what we do. We could have raised their pay to equal that amount, and then said just because we're going to keep the same, but that would have increased overtime because the pay by base pay would. But one of the things I think that was good is this is what we pay these people, and this is what they're worth, and they're good at what they do, or they're the best at what they do, and then we're going to pay them for that. So I think those were really key to this board saying we appreciate the hard work the deputies and the sheriff's department have put in, and all our employees. And so going through this, but this is a very complicated, and I know that part of this is some of these questions, and I hope that this was it answered almost all your questions you would test, because as I was going through it with Catherine, I said, this may bring up a question, I don't understand it, and she was able to put some of those pieces in for me so I would understand it, These are a lot smarter than me, so so these people here understand that. So, but there is some of that. So now, with all that, I look at, some of this stuff, the cost sharing, the governor said we want to get people to cost sharing. We want people to put a portion of their pension, we want them to pay a portion of their pension. And as you talk about that point, whatever 10.9 has been negotiated over the years, and the sheriffs opened their contract voluntarily and said we'll pay 2.8, so that was really good. I mean, we did some of those things. However, going through all that, we realized some of these things. So as I see this, there's a lot of really good things that have been done. I mean, the CTO, that's that is good that we're making some changes on that, because as you saw, it could have been used to a disadvantage of the sheriff's department and cost the sheriff's department a lot of money. So fixing that, but the guys who got paid, they're getting paid out instead of putting in. We had 480 hours of that. We're down to 360. I would have liked to see that gone lower, like more of the other counties and cities. But at the end, the sheriff said, "Look, it just saves me right now. I put in the cash out, or I put it out and I pay it later." So maybe some things we can work on going in the future to try to get some more of those things done. Now, I look at the regular overtime of about 218,000 hours. I think we saw that in something that you had done,
Yes.
right? Total hours.
Yes.
So I look at that, and I do say, though, that if we have that and you calculate that $5.71 difference or whatever that is, that does work out to about $2.4 million, $2.5 million in overtime increases. So we are saving $750,000 on the one piece, but we have the other regular overtime that goes up because of. So our net cost probably increases about $750,000. But there's a cost for transparency, but we pay that now. But in the future, if, like you said, if things start to go up, everybody starts to share in that pension cost. If when I first came here, we were at $80 million in pension costs, now we're $180 million, there would have been a greater sharing of everybody. It's their money. It's the employees' money that is going to be theirs at some time. So I think that's a key piece. So there is this increase that people are going to get the 5 or 6%, all these different little pieces which is great, because I've always said, just pay the people, make it as transparent as possible, pay them. These people are worth what they're paid. And don't let anybody tell you that being a sheriff's a $50,000 a year job. We know it, and I think the paper came out and said it. It's a $100,000 a year job, and guess what? These guys deserve every nickel and every penny and every dime of what they get paid. No question about that. It's a good job. It's a great job. They go out and protect our lives. It's what they should be paid. On the other side, though, there's going to be some additional increases for guys who do overtime. And I could look at this and say, wow, should we have gone 14.5%? Should we have gone 11% because the overtime is going to increase and they're going to get a double pay? Well, the problem is I go through this payroll record here, and not everybody takes the same overtime. It's a difficult situation. Some guys have lots of overtime, some guys have a little bit of overtime, some different levels of the sheriff's department don't get overtime. They get to a certain level of commanders and all that don't get overtime. So they would be taking a little bit more of a hit. So as I look through some of this stuff, is trying to find this balance, and these people have known before, I'm struggling with part of the contract because there is some of that stuff. But as you've done a really good job of explaining this, I can come back and see that you've really put together, and I think the union has come together and said, look, we see the issues, we want to work together, because again, we're not seeing a major cost savings, right? We're not saying all of a sudden, wow, we just saved $5 million or $10 million. Because I think part of this board said, we appreciate these people, we're going to pay these people what it requires to pay them. And so we weren't looking to save money. We were looking to get the contract as transparent as possible. We were looking to get the contract as participant in the sense of what the governor wanted to do and the cost sharing going forward. I think we wanted to do that. And I think this board, through all this hard work and all the detailed information that the CEO and you and your whole team have put together, I'm glad you guys are mathematicians because, man, this is crazy. But really, I mean, that's it. So I look at that, the idea that, okay, the 14.5% does give increases in the average person who does do a lot of overtime. He's going to get a pay increase, or he or she is going to get a big pay increase. It's going to get a pay. I'm not going to say big. It's going to get a pay. Because to me, I would have just said, if you got to pay them $40 an hour, you got to pay them 42, 45, whatever they're worth, that's what you pay. And so this is what it's going to do. But so that's my biggest piece I struggle with, is that, but on the other side, I realize there's a lot of senior guys who don't get overtime. And so it's not like the fire department or some other places where they get overtime no matter what. So that's a struggle. So if I look at that, from that standpoint, I want to be as consistent with all the people as possible, because they've done a good job. We live in the best place in the world because of these people. So I just got to say that I'm going to be supportive of this contract that we put together. So I appreciate what you've done. Thank you.
Appreciate those comments, Supervisor Foy. I just want to try to point one aspect of the contract out that I think the public should be aware of, and that is that the 50-50 normal cost share that we have in this contract, I believe achieves a good government policy that we haven't talked about yet at this point in time. But the retirement board is made up of 4 members that are appointed by labor representatives, et cetera, and then there are 4 members appointed by the board of supervisors, and then the treasurer is the elected person who serves on the retirement board. In the past, when there have been votes in front of the retirement board on things that would increase the normal cost share, those votes, I mean, just human nature would say, if somebody else is going to pay the bill, then you have a different kind of incentive in terms of evaluating decisions about normal cost share. Now you're going to have the labor representatives and the management both sharing 50-50 in it, and there probably will be just a more appropriate evaluation of normal cost, and that's just good government for the public to have everybody at the table equally invested in decisions about what's going to affect the normal cost share. So it's a small point, but I wanted to try to point that out from a good government standpoint. Again, I think I'd like to congratulate all the participants at the table. I think that experts in labor finance have told us you're biting off a lot of moving parts with this. From the very beginning, we knew it was going to be take a lot of good faith effort, a lot of time on everybody's part. There were a lot of moving parts, and for the benefit of the public, some of the charts that we saw there are the charts that we spent hours on in closed sessions, trying to make sure that we understood all this. So I would like to congratulate Catherine Rodriguez and her team, Rick Schimmel, his team, the sheriff for his participation, Mr. Powers, and my colleagues on the board who spent a lot more time than the board used to spend in closed session, trying to make sure that they really understood this. So this, I think, is a very important and union labor negotiated contract here that we have in front of us in terms of moving forward. And when the next entity achieves 50-50, I hope you'll let us know, because I have a feeling we'll be sitting here for a long time waiting to find other places that get to 50-50 and get to that appropriate cost sharing that was one of the real keys of pension reform at the state level. That I think we asked for lots of things at the state level to happen, and those things happened. And then we needed to deliver on our side of it, which was we asked for these things, and the 50-50 cost share is one of the things that, again, not just us, but our labor partners stepped up and delivered for the taxpayers of Ventura County. So thank you very much. Appreciate it.
Mr. Chair, I also want to thank, Catherine and Mike Powers and the whole team, and Tabine and Jim and individuals that have worked day in and day out. It kept us in closed session for hours and hours and hours. But I think that the important thing is that the partnership that the Board of Supervisors, the sheriff, the deputies, and Mr. Schimmel and his people have done is just excellent. What we want to do is come out with a proposal that's going to be a win-win for both the taxpayers and both our deputies. They're the vanguards, they're the people that take care of us, they're the people that work day in and day out, 24/7. And I think it's important that we be transparent with the public to make sure that we show the cost, and you've shown the cost of what the normal cost is for operating our sheriff department. The cost savings of $750,000 that we're going to be saving year after year after year. And of course, our major concern was overtime. How can we control the overtime and yet be fair with everybody? And I think the solution has come. It's not perfect, but we're working on it. The important thing that was mentioned before is a 50-50. I think we're probably one of the few, if maybe Kathy, the only county that's done the 50-50 cost sharing on pension, and I think that's very significant. It's going to help us all in the future. And as was shared before, the deputies did share in the past. They worked with us when they gave 2.5% of their dollars to help us, and we appreciate that. So I think in the long run, this is fair to all the taxpayers, our deputies, and also the public that we serve. And public safety is number one. And I just want to commend all of you and for the good work and the board. That when we were back there in the room, there was a lot of talk. Many hours of negotiations and how does this work, and how can we help the deputies, and how can we be transparent, and how can we tell the people exactly what we're doing. But I think this explanation it's very good for the public. It's difficult. There's a lot of things that'll be tough to understand, but I think you've done a good job. And I want to thank you and the board, and the deputy sheriffs for helping us out.
Thank you. Supervisor Long.
Yes, thank you. I too would like to thank Ms. Rodriguez and the labor team and the Sheriff's Deputy Association labor team, labor group, Mr. Powers. As you were walking through this, Catherine, and yes, we have lived and breathed it now for months, and looking at the various charts, I'm looking out at folks and I see a lot of egos out there, and that stands for eyes glaze over, because it is complex, and we found it even more complex as we drill down, and looking to also honor and respect the workforce that has served this county well, that keeps us at the top of the list as one of the safest counties this side of whatever major river has water in it. And I think that the board, over the years, we have been able to build trust in both the relationships, but also in looking at our total responsibility and management of the taxpayers' funds, and developing, dealing with structural deficits, establishing over the years both the goals we're trying to achieve and the transparency of those goals. I think that we have, what has brought us here today is because we did take even tough steps years ago that have enabled us to have both the trust at the negotiating table and the leadership willing to look internally at their operations to see, what can we not just live with, but continue to have a strong workforce and continue to be competitive and able to recruit a strong workforce. And that is both salaries and benefits. And it's that total package. So I think what we've achieved here both respects that and will continue to keep us in a good position competitively to have the best of the best when we go out to recruit for personnel. So I thank you for your hours and hundreds of hours and the board. It was good work. Thank you.
Supervisor Parks.
Too, thanks to Catherine and your team, and we spent many, many hours in close contact and working through a lot of the information in these packets were because we kept asking more questions and getting more analysis. So I also want to thank the board. We really did get very thorough in looking at it, and while it's incredibly complex, a lot of this we learned as we went through and found out more things that we could go for. I agree a lot with what Supervisor Foy said, except for one thing he said is we weren't doing this to save money. And actually, I think we were doing this to save money, and we are seeing some future benefits of this that are going to continue. But when we began all this, it was before the state acted with their Pension Reform Act. And they really, I think the state act has done the most, and that is by preventing spiking, by having a cap on pensionable income and what is pensionable. So I think that made a tremendous benefit, and that was something we were trying to see what we could do. But that was a good first step. And then also being able, as we were talking, to be able to achieve probably the first in the state, as you're saying, to get that 50-50 share. And thank the Deputy Sheriff's Association, too, for coming to the table and working with us so we can do this. I think overall, as you look at our pension system, they are saying the actuarial was thinking we'd be doing about 4% a year. This is only 2% a year, so this contract doesn't hurt our retirement system, and that's good too. But another key, in addition to cost savings and transparency, is to make sure that we can stay competitive. So I'm really happy that we were able to do that. Could we have done more? No, I don't think so. But I think we can, and as we continue through the years, we will always be able to see what more can we do. But I think what we have here today is something that works and something that benefits both the taxpayers, keeps us competitive, and then also make sure that we do everything that we can towards pension reform too, and I think this does it. So thank you so much for your work, and Mike for continuing to push with us, and I'm feeling very positive about this. And just a last comment is how quickly it went. I mean, after we worked through it and came through with a very good proposal. I see some other unions out there that we're looking forward to, but it's smart to go soon, because when you go soon, you get the initial benefits from the contract. So I'm hoping other unions that are still out there will see that their employees are going to benefit as soon as they sign on the bottom line.
Mr. Powers.
Thank you, Chair Bennett. It's all been really said. Just again to thank your board for your commitment and going through the trilogy of the labor binders that you did, and your commitment and evaluation of that. Also, in terms of the number of people, they've been mentioned. I want to just single out a couple more people, and that is Matt Carroll and Paul Dursey from our office, key members of our team, and Kelly Shirk, as well as a lot of legal issues, as you can imagine, in this. So Leroy Smith and Matt Smith, Smith brothers. Want to thank them for their work too. And you said it, Supervisor Long, relationships and trust. That's what I think this has a lot to do with, your board's relationship and our office's relationship with our labor partners out there like DSA. And I think that really shines through. And another big piece of this too is our auditor's office. Our new auditor, Jeff Berg. So nice honeymoon, yeah. And your team. I know this is a complex, lot of moving parts, and we appreciate your support and assistance with it. So thank you very much.
And I might just point out that you you're going to make some mention as to the extent that this has any effect on other union contracts, that we'll go back and make appropriate modifications.
Thank you, Supervisor Bennett. Thanks, Chair Bennett. Yes, absolutely. There's, just to be clear, we've always said we would, keep faith with our partners out there and relationships and trust. And to the extent there are some terms in this agreement that are more favorable than the agreements already reached with the labor tables like SEIU and IUOE, as well as our managers, we will go back and make those adjustments.
Well, we're at a happy moment. We're ready for, we have no public speakers. We're ready for a motion and a second.
And while we vote, I do make a couple other comments. I didn't want to, I wanted my comments and you guys to do your stuff, because there's still a couple other things that during this we did not mention. First of all is that one of the things that was out there is that we didn't mention that we have Pepper employees, and you have a lump sum coming to them to make up what they had to pay during this same time. We had officers working, we had same officers working, same salary. They had more coming out, so they had less. So we're going to make that up. Now, in the sense of that, that really goes against the governor's PEPRA plan that was employees. However, why I'm voting on this is because the idea is we said that we have a salary base that we want to keep our employees at. We want them to be well paid, they're just well-paid people. They deserve it. So that's that's why I do it. But I don't want that to go away. The understanding of that piece is that is a key, that we're going to pick that up so everybody's paid the same and going forward. But that is not a practice that now that we're paid at this level, people are paid, there'll be a regular 1, 2, 3, 5%, whatever that is. But going forward, things change. I don't see, that's not something that I would see as we're making up when things change in the governor's office or anyplace else. However, we do believe that people should be paid. And so what would have happened is they would have taken a major reduction in pay for that situation. But at the same time, that pay now is they're going to have to take that pay and put it in. And for the other people, we were already paying it anyway. So that's not something that's costing us in a sense. However, the other thing, there's one other piece in here that I know that you're working on. We didn't get into this contract, which is what the retirement board has a big issue with, and that is an issue that somebody can go to work in the academy before they're sworn, before they put a badge on their chest, break their ankle, get disabled, and now get a pension from 22 years for the rest of their life with this disability. And so I know that Mr. Schimel and you are working through that issue. We talk about protecting the plan where no dollars ever went into that plan and somebody's pulling money out for the rest of their life. We've got to work on that situation to do that. And that's happened because and how they're classified is what that is. And I know Catherine and Mr. Schimel have tried to work through that. We didn't get it in here at this point, but I know Mr. Goulet is very adamant about. I keep getting emails that we get it done, and I think it's important that we do. Not that against any of those people that are in the academies are good, but they're trying to become an officer. They haven't made it through that, and those benefits for somebody like that, we have to get that worked out because that's very detrimental to that pension plan. So anyway, so again. Thank you for all the hard work, and I appreciate you putting together very understandable. I think she's right, though, glazed over, but people can come and say, how do I understand the sheriffs? Come at 9:15 on this day, and listen to you speak again. You'll understand.
Oh, my.
Okay, we have the motion by Supervisor Long, seconded by myself, in front of the board. We're ready to vote. And I think we're all happy to say that's passed and passed unanimously. And now we're ready for our 10 o'clock time certain item. And we have a number of people that have been waiting out in the audience patiently. I would like to, from our Women's Economic Roundtable, we were going to have Linda Catherine Lee here. She was not able to be here. So I'd like to introduce Jody Skandarian, Gina Jager, Lori Brown, Selena Sicarius. And then we have, we're really pleased to have one of the two women who we have now made sort of the memorial for Women's History Month, and that's former Supervisor Maggie Erickson Kildee. Would you please come down, Supervisor Kildee, to join these women? We have We have this resolution. It's fairly long. I'm not going to read the whole resolution, but I am going to read just a few parts of it. And this is a resolution proclaiming March 2014 Maggie Erickson Kildee and Susan K. Lacey Women's History Month. Susan Lacey is the other supervisor that served alongside of Supervisor Kildee. And whereas Ventura County residents will join women and men around the world during the month of March to celebrate National Women's History Month, observed under the 2014 national theme, Celebrating Women of Character, Courage, and Commitment, honoring the extraordinary and often unrecognized determination and tenacity of women. Against social convention and often legal restraints, women have created a legacy that expands the frontiers of possibility for generations to come. And it is, at this point in time, I would point out that it was established last year. March would hold a particular significance in Ventura County as the Ventura County Board of Supervisors named Women History Month in Ventura County in honor of two pioneering female county supervisors, Maggie Erickson Kildee and Susan K. Lacey. And at this point in time, the board's commitment to the advancement of women in our county, on August 6th of 2013, the Board of Supervisors approved the creation of the Women's Economic Roundtable Advisory Committee with the mission to work to create and promote economic development and career opportunities for women, as well as address pay equity gaps women in Ventura County face. The WEAR, which is the Women's Economic Roundtable acronym, consists of 10 members, and we have 4 of those members here today, and we look forward to hearing from you if we could, and we appreciate Supervisor your attendance here also this morning. I'm going to come down and bring this, and we'd like to hear from you here, members of the Women's Economic Roundtable. All right. Thank you very much.
To go now?
Please.
Yes. All right. Thank you, Supervisor Bennett, and good morning, supervisors. It's an honor to be with all of you here this morning. On behalf of your appointed Women's Economic Roundtable Advisory Board, we thank you for recognizing and celebrating the 2014 National Women's History Month. When we think about this year's theme of inspiring change, we can look both nationally and internationally to both women and girls who have inspired great change. We think of courageous girls like Malala. She's the Pakistani schoolgirl whose blogs at the age of 11 made international headlines. As we celebrate Women's History Month, we also pay tribute to the lives of countless American women who have made great sacrifices, who have embarked on meaningful endeavors, and who have torn down historic barriers. From the courage of women like Amelia Earhart, Susan B. Anthony, Annie Oakley, Sally Ride, and Rosa Parks, to name just a few, our nation's past holds a wealth of women heroes who inspire all of us with great examples of how to lead and make a difference while inspiring change. The inauguration of the Women's Economic Roundtable brings continued social responsibility that will foster career development of the next generation of women leaders. The 10 members of the Women Economic Roundtable are talented, professional women of great diversity. The richness of the past and the current progress of women today set the foundation for the Women's Economic Roundtable advisors. Today, we renew our commitment to charting that course as we embark on pioneering the future. Thank you.
Do we have any the other 3 members of the roundtable? All righty. Great. Supervisor Kildee, could you grace us, please?
Thank you. First of all, I have to tell you how grateful I am that it was me sitting out there and you sitting up here while you were going through all of those negotiations. I remember those days, and I appreciate the work that you do now for the people of this county. Thank you for recognizing Susan and me, but most of all, thank you for the work that you continue to do to support women, particularly in Ventura County, evidenced by these women standing behind me, but also the many women across the county in countless ways that you continue to support and to uphold, so that more and more we reach the kind of equality that says men and women who have talents are able to use those talents, whatever they might be and wherever they might be. So thank you for that recognition, and thank you for what you do.
Supervisors, would you come down and join us for the picture? Thank you very much. Can we have you hold this right in the middle? All right, and if you two on that side, Maggie right here, right next to this, there we go. And then the other supervisors, and Anna, wherever you're gonna get, but there we go. If we'll turn our shoulders, we'll be able to get in a little tighter here. There we go. What's that? Oh. My cheat sheet's on there. Huh?
To know this woman here. Thank you all. Thank you for coming in.
Supervisor.
Thank you.
Nice seeing you.
Thank you very much. Thank you so much for coming by.
Oh, yes.
Two granddaughters that go take after you guys.
Okay, board members and audience, we have 11 o'clock Air Pollution Control District, and I'm sure our staff would like to be done with the board meeting so they don't have to wait around. So we have our other 10 o'clock time certain, just a few minutes late, presentation of resolution proclaiming March as National Nutrition Month. And Supervisor Long.
Yes, thank you, Mr. Chair. And thank you all for being here. I'd like to invite up Selfa Saucedo, who's going to lead us through this recognition of both National Nutrition Month and the Ventura County's Health Champion Awards. This is something that we do every year to really celebrate the successes in our county. Selfa is Ventura County Public Health and Partnership for Healthy Ventura County co-chair, and will be speaking to the Nutrition Month. I'd like to first say a few words about from the resolution that will proclaim 2014 National Nutrition Month, March 2014. And it certainly speaks to the statistics of adults in our county who more than one half of which are overweight or obese. More than 1/3 of Ventura County's children are overweight or obese, with figures among some local cities much higher than that, unfortunately. How this impacts us both in our health but also in our economy and in our quality of life is that you get some lost productivity, you get obesity-related conditions that cost the state of California well over $28 billion a year. The Academy of Nutrition and Dietetics recognized March as National Nutrition Month to raise the understanding and the opportunity to educate the public and engage the public in real things that can make a difference to them individually and their families. This year's National Nutrition theme is Enjoy the Taste of Eating Right, and it is to really look at healthy lifestyles again, promoting good food choices, physical activity, and sound eating. And the opportunity to celebrate this Partnership for Healthy County, again, will recognize our health champions, and we'll do that with some awards to go to them. And so I will invite you, Selfa, to speak to introducing your co-chairs and talk about the champion awards and the awardees who were selected. I will step down with the resolution, and we'll do all of it together.
Thank you very much. Good morning, Chair Bennett, members of the board. Enjoy the taste of eating right is the theme for National Nutrition Month 2014. Consumer research confirms that taste tops nutrition as the main reason why one food is purchased over another. While social, emotion, and health factors also play a role, the foods people enjoy are likely the ones they eat most. This year's key messages for National Nutrition Month focus on how to combine taste and nutrition to create healthy meals that follow the dietary guideline recommendations. National Nutrition Month is a nutrition education and information campaign created annually in March by the Academy of Nutrition and Dietetics. The campaign focuses attention on the importance of making informed food choices and developing sound eating and physical activity habits. Celebrating National Nutrition Month today, I would like to introduce the chairs of the Partnership for a Healthy Ventura County, a coalition of community partners dedicated to the goal of healthy eating and active living for all Ventura County residents. Please welcome Nancy Maxon, Coordinator for Health and Prevention Programs for Ventura Unified School District, and Robin Godfrey, Director of Communications, Education, and Development for First Five Ventura County.
Chairman Bennett and board members, thank you so much for allowing us to come in today and honor these groups. We appreciate your proclamation. The committees of the Partnership for Healthy Ventura County identify and honor agencies and organizations that represent healthy eating and active living in their work. Each organization being honored today exemplifies the best of Ventura County. We're proud to support the work that each organization does to help make Ventura County the healthiest county in California, and we appreciate your support in honoring them today. Thank you.
Okay, board members, I'm going to do this backwards, just because I would like the groups who are going to be honored today, as I call you up to recognize you, and we'll take a large group photo, so you can line up here. Good? Yes. Good. Okay. And we do have certificates for all of them, but they had some slight corrections to be made, so we'll provide them to you after this ceremony. So the first one up is through the K through 12 Coordinated School Health category. The winner is the Ventura County Farm to School Collaborative. Yay! The recipients are Karen Muniz from Ventura, Susanna Lugatoff of Ojai, and pardon me if I pronounce that not quite right, Laurel Gaines from Rio, Jim Piccola from Oxnard, Joanna Corina from Wainimi, Port Wainimi, Sandy Kerwood from Caneo, and Karen Schmidt, the coordinator. Correct? Yes. Did I catch everyone? Yes. Okay, great. And the farmers, absolutely. We're so fortunate in this county to be able to have a program like this and have it be so successful. And it is with the collaborative of our farming community, so thank you all. And please stay up here. Our Healthy Families and Communities category, the winner is the Oxnard Scholars After School Program. Are they here? All right. And representing, we have Alejandra Leon, the Recreation Coordinator, and Water Heroes, correct? Great. Thank you. And then Healthy Living for 55 plus, that's me. The winners of Ventura Adult Continuing Education category. And representing from there, we have Teresa Johnson, Director and Principal of VACE, Ventura Adult Continuing Education. Yay. And in the Workplace Wellness category, the winner is Alcoa Fastening Systems, Newbury Park Operations, and the award recipient is Kristen March, Plant Manager, Maria Calderas, Human Resource Manager. And the Healthcare category, the winner is First Five Ventura County. Yay! And of course, Claudia Harrison, our Executive Director of First Five, and good to see Dr. Golub, who is on our First Five Commission. Retired pediatric doctor. Cares about those little ones. Thank you. And in the Communications category, Bell Arts Factory, and the award recipient, Jim Rice, President and Executive Director of the Bell Arts Factory. Jim? Good. So these for both the public and the board members, these are our health champions. These are the ones who are really making a difference in our county. Now, scooch down this way because we're not going to get the picture. If you can make some rows here, that would be great. We're going to disappear behind this very large podium. And where's cell phone? Come on. Do you want to hold this in the front? I'll stand on the side. Make sure everybody, you can see the camera, can see you.
Look over here really quick. 1, 2, 3.
Okay, Salva, you do a great job. Thank you, Public Health, for being such a great leader in this. Both the recognition and the importance of keeping all of you engaged and keeping our communities healthy. Thank you so very much.
And Salfa, and Kathy and Salfa, thank you so much, Salfa, for your good work that you're doing, and all the individuals. Thank you.
And we're going to move right to our item 21. That's if the people for the Ronald McDonald House will come on down for this item, the healthcare agency. Good morning. Thank you very much.
Good morning, Chair Bennett, members of the board, CEO Powers. I am Cindy Cole, Deputy Director and Hospital Administrator for VCMC in Santa Paula Hospital. I would like to introduce the people at the podium with me today. I have Amy Towner, who is our VCMC Capital Campaign Director, Karen Kwan, who is the President of the National Charity League Juniors, and Don Brown, who's the CEO of the LA Ronald McDonald House, as well as some of our physicians and nursing leaders who are in the audience with us and members of the NCL Juniors. Thank you for the time today, allowing us to share some good news. A few months ago, we began discussing the possibility of a Ronald McDonald family room within the walls of the VCMC hospital. We thought that after the construction was completed, we could use an area near where the pediatric unit and the PICU and the neonatal intensive care unit would be, as well if we had that area, it would allow the parents easy flow back and forth to their children. In November, we met with members of the Ronald McDonald House Charities, including Vincent Bryson, the CEO of that charity. The participants from the county and VCMC side included our county CEO, Mr. Powers, as well as VCMC administration and our physician and nursing leaders. To put it bluntly, we wowed the group from Ronald McDonald House Charities. They looked at the space we were considering and also talked with all of us and heard the passion and commitment as a hospital and county that we have to providing care for pediatric and neonatal patients. Within a short while, we heard from them that their board had voted to work with us on a joint venture. A copy of the letter from Mr. Bryson is in the board presentation. As we were developing this connection, Amy met with the NCL Juniors and they decided that if we did get chosen to place this family room within VCMC, they would commit to supporting this endeavor with a portion of their proceeds from their gala, which happens to be next week, in case you didn't buy a ticket yet, as well as on-site volunteering at the family room once we get it open. As you know, the power of many make things happen. We are proud to have the relationship we have with our NCL Junior group. And now we have added another amazing group, the Ronald McDonald House Charities, to our growing program of providing the best, most complete neonatal and pediatric care in Ventura County. I'm going to read you just a little excerpt from the charities. Research shows that a family's presence in the hospital helps children heal faster. Staying close by allows parents to better communicate with their children's medical team and improves adherence to complicated treatment plans. These are only some of the reasons that make the Ronald McDonald Family Rooms an important service. Now I'm going to show just a very short video. Actually, Brian's going to make that video happen.
I remember her smiling, and I always hold her hand because she always makes me laugh.
It was just like any other day, really, for me, for all of us. Our daughter Ava, our oldest daughter Ava, was picked up from preschool. On the ride home, she just kind of stopped talking. There we were, looking at our 5-year-old daughter hooked up to absolutely every piece of equipment that they had available, and we were in shock.
Having a child with a extreme illness, to put that into words is I can't put it into words.
We just sat there because you're helpless. So what do? The nurse encouraged us to just take a walk. And that's where the Ronald McDonald Family Room played a huge role. Ronald McDonald Family Room is a home away from home.
We often had great experiences at the Ronald McDonald Family Room.
We had a good time playing, and we always watched movies together.
The family room gave us a place to meet other families who knew what you were going through.
It brought our family together. We were able to sit down at the table and have a meal.
Some days you just walked in, you got your soda, you got your chips, everybody laughed about something, and that's exactly what you needed that day. There are other days you just needed that hot shower, because a hot shower suddenly becomes the most important thing, the only thing that you can look forward to. That one thing is the thing that gets you through and lets you keep smiling and fighting for your kid.
So, we wanted to bring this opportunity to the board to let you know that we'll be working on this for the next 3 years until our hospital replacement wing is finished. And then we'll go into full mode of rehabbing an area of the hospital on the 3rd floor that is directly adjacent, as I said, and we are very proud of this opportunity. There are only 2 other Ronald McDonald Family Rooms in California. So we'll be hopefully the 3rd if nobody else gets in there in the meantime. So we thank the board and Mr. Powers. Really a huge appreciation to you for participating in the tour. It really did make a difference. So thank you for the opportunity to share this with you.
So exciting.
It is.
And just also thank you to the Junior Charity League. I know that you have brought so much, and including helping us connect with Ronald McDonald House, and just so glad that you chose our hospital. So thank you. I know many families in the future are going to be very more comforted. So thank you for that.
Is there anything you would like to say as a representative of Ronald McDonald House?
Sure. We're very excited about this opportunity to partner with the Ventura County Hospital, and we look forward to continuing to partner with Ventura, the city, as well, to make this happen.
Well, we really appreciate it here, and appreciate everything that you guys do nationwide in terms of Ronald McDonald House and stuff. Right?
And Mr. Chair, being the 3rd of how many hospitals across California, it's I want to thank you for that and for choosing Ventura County and helping our families and our children. Thank you.
Thank you.
Mr. Powers?
I just want, thank you. Thank you, thank you, thank you. We are so very proud of what we have here in this county and our entire healthcare system, but in our hospitals specifically, because we have the best doctors and nurses and caring people. Everyone in that hospital who walks those floors cares about the patients we serve. And to be able to have this for our children, I'm very pleased.
And let me say that was evident in our site visit, and that's why we decided that we wanted to partner with you.
Mr. Powers?
Thank you, Chair Bennett. Cindy, thank you to you for your leadership on this. I know you've had this vision. And Amy and Karen, the juniors, you guys are a force of nature. And we're how lucky we are that you're with us in that force. And Dawn, it's such a great natural partnership with you. We're so excited and grateful. And then I want to just mention also our physician and nursing leadership out here. It is the quality of care and the skills and the compassion that all of you have that make this happen. None of it would be happening without it, so thank you.
I'd just like to finalize by saying what you saw there that attracted you is a culture that has been nurtured for quite some time here at the county hospital. And so to Cindy for continuing it, but for Mike Powers, who was there, for the doctors and all the people in the past. I mean, it is something I think we all know is a precious asset, and that is this unique group of individuals in this unique culture where everybody really has a passion that goes beyond what you see normally in hospitals. And so the citizens of Ventura County are really fortunate, and you've just made life even better for them. Thank you very much. Really appreciate it. All righty. Thank you. We will do everything we can. Oh, we have to move to receive and file. Approve that. We all look forward to seeing that room come in, and let's we'll get through I believe we'll get through both the healthcare agency, probation, and public works for your benefit before we get to 11 o'clock. We'll go fast, so if you'll go fast. So why doesn't probation and public works come down and be on deck so you're up close? And let's go healthcare agency for item 28.
Did we finalize the vote? We didn't get a vote.
Oh, did we get the vote done, Brian? Oh, great. Thank you. All right. Item 28.
Good morning, Chair Bennett, members of the board, and Mr. Powers. Melanie Roy from the Behavioral Health Department. More good news from the Healthcare Agency. This item 28 requests your approval for a grant that the Behavioral Health Department submitted. This was part of the SB 82 funding and Mental Health Services Act funding. And what we did was we submitted a grant requesting $7.6 million to expand our crisis personnel in this county.
This is a small little one-time item that's not very big deal, right?
That's right.
Wow.
And I'm going to go fast through it.
But I am sorry we don't have the time or the audience for this. This is a remarkable accomplishment that we have here in front of us with some tremendous benefits that are going to come here.
Yeah, we're going to be doing some expansion. We're going to be able to support the inpatient unit more, various entities in the community by having crisis personnel there, assessment personnel there. And I won't go into all the details, but one thing I do want to say, because I want my staff to get the credit, is that we scored the highest score in Southern California.
Is that right?
And that was important because they funded the grants in order of the scoring process, and so we were able to get full funding for our requests. So we were really excited about that. If you have questions, I'm certainly willing to answer them. I didn't know you want us to go quickly, so I can explain more, but I will leave it to you for
Number one, congratulations to everybody to get that score. Why don't you take a minute or two and tell us what you think the real key high points are that the public should be aware of in terms of what's going to happen?
I can do that. This grant is to expand our ability to provide very integral crisis services in the community, and we are going to be acquiring more staff to increase our hours in East County for crisis intervention, expand accessibility so that when people call us and we're not just going out to do a evaluation to determine if somebody should be hospitalized, but we'll be able to intervene more integrally to prevent the hospitalization and respond in person to calls that today we are unable to respond in person. We're going to have a rapid assessment field team, which we will be able to go out to the Samaritan Center, for instance, more availability at the one-stop tent cities, other locations in the community to provide evaluations right there on the spot. Sometimes we try to connect them to our teams, and it's very difficult to get these people sometimes to show up for an evaluation. So being able to go out into the field and conduct the evaluation right there on the spot is going to, I think, really help people access services. We're going to have some individuals working at the ER and at the inpatient unit to help with those connections. Again, sometimes people are given an appointment, and we do our best to try to get people in, have a warm handoff, but we're actually going to have people who can literally almost walk people through the stages to make sure that they get connected to the department. We have a bridge builders team we're going to have that's going to be able to follow people again from the inpatient unit to the outpatient unit to make sure they get linked, and then some individuals to provide services to homeless, strategically placed in Oxnard and Ventura. So it's big. It's 20 positions, and it was one-time funding. However, the talk really at the state level is that if there is sufficient MHSA funding going forward, that this would be refunded. So that would be our hope. We certainly will be looking for sustainability. It's really important. It's a viable program. It's something we really need. It filled a gap. So as we go forward and we're looking at our funding sources, we'll be looking to make sure we can continue this in every way possible. So.
Great. Well, we all certainly hope that you can continue this funding.
Sure.
Once we get this started, we're going to certainly want to keep that.
And the funding goes through 2018, so we've got...
Wow, great.
Yeah.
All right.
If I could just follow up on that question, because if it does, I mean, it sounds like it could be a good program. How else, if it didn't come through there, where else would you find the funding? Because, it's also really hard to stop a program like that.
Sure, yeah, no, I understand. And we're asking for fixed-term positions. Every year we have MHSA planning with a very robust stakeholder process, and what we'll be doing as we look at our funding going forward is certainly looking at this program as we go forward, and any available funding from MHSA or otherwise. We're doing we've had great sign-ups. We've been working to get people signed up for Medi-Cal very aggressively at behavioral health, and I think we've got over 400 people signed up who were not signed up before. So that's another way. We need to make sure we're maximizing all of our revenue.
You mean that's another
streams.
way that can help this in the future?
Yeah, the more people we have funded, and either sponsored by Medi-Cal or other insurance sources,
Right.
The better off we are in terms of our whole payer mix. So we're really aggressively going after all types of funding, because these are programs that we need to continue.
I appreciate that. I mean, it looks like it could be some really good stuff. It's just $2 million a year, or $3 million, $2.5 million. It's a lot of money when all of a sudden, whoop, it stops. And
You're
the
right.
state says we don't have it, and then you're in the middle of something. If you have other ways to try to, because it's really hard to stop that, you have to take something else. So, okay.
Agreed.
We're in charge of the health, welfare, and safety of the citizens of Ventura County. I mean, that's our basic mandate. And I really believe that besides the opiate crisis that we have in this county, the mental health crisis is really, those are the two areas that we can most, I think, impact or improve the quality of life here in Ventura County. And so, great effort. Supervisor Parks?
I just want to compliment both the Behavioral Health Department, but also the healthcare agency altogether, because this is really looking internally, seeing where you have gaps, but also listening to the Behavioral Health Board, which is so wisely made up of consumers and family members and people in our area who are really attuned to what needs to be done out there and what the needs are. So just, first of all, just congratulations on being able to really see, and I really feel from what I reviewed, this really does go to fill some gaps that are going to just really, I think, help in treatment, but also help in that recidivism. We saw what we did with the jail task force, basically reducing recidivism in the jails from 70 down to, as low as 17%. It has a major impact. And also listening to the hospitals, being able to go out to the hospitals and assist them when they have a 5150, and that warm handoff, both into the IPU, but also leaving the IPU, I think is just essential. I think this also can lead to the establishment of an emergency psych portion if we're going there. This will be a good step in that direction. So I know that the Behavioral Health Advisory Board will be completely thrilled with this, as I am, and just thank you for that internal look and for really addressing those gaps out there. I'm really excited about this.
Thank you, Supervisor Parks, and thanks for your efforts on the Mental Health Board.
And we're
All right.
awaiting word for the second grant that we were participating in applying for in collaboration with the inpatient unit and with Casa Pacifica for other crisis-related services. So we'll cross our fingers on that one.
And we're ready for a motion on this item?
And Melanie, thank you so much. It's like you said, it's a mental health triage, and thank you for the good job.
Thank you.
Yeah, good grant writing.
We're ready to vote. And for the APCD people in the audience, we're going to try to finish our other two items so our staff can go back to their regular day. And
Thank you.
Probation.
Thank you.
Item 29. That motion passes unanimously.
Chairman Bennett, honorable members of the Board of Supervisors, Mr. Powers. Hi, Jeff. Patricia Oliveras, Chief Deputy Probation Agency. Good morning. On March 1st, 2013, your board approved the original contract with the Boys and Girls Club of Greater Oxnard and Port Hueneme with a term ending on February 28th of 2014. In order to continue the operation of the Evening Reporting Center to the end of the fiscal year, we are requesting your board to ratify the amendments of the contract, to correct the name of the organization, to increase the contract by $78,187 and extend the contract term to the end of the fiscal year, June 30, 2014, with the option to be able to extend an additional one-year period and increase the maximum amount of the contract to $304,746. The Evening Reporting Center is being used as an alternative to incarceration for identified Juvenile Justice Crime Prevention Act youth struggling to comply with their court-ordered obligations and who are at risk of returning to custody. We were here before your board on November 12th, 2013, at which time we provided an update, progress report, so to speak, on how the Evening Reporting Center was doing. At that time, you heard from not only our chief, Mark Varela, but you also heard from Division Manager Teresa Hart, who's here with me today, Supervising Deputy Probation Officer Rosa Lopez, and Director of Programming Services Aaron Antrim from the Boys and Girls Club of Greater Oxnard and Port Hueneme. The preliminary data, and preliminary I mean by 6 months, not a whole lot, was collected and analyzed by Dr. Jamshid Damui, and he suggested that there was a significant improvement in positive outcomes for participating youth. Dr. Damui further noted that there appeared to be a decrease in recidivism among this participating youth. Since then, we have maintained a full cohort, and we also have a waiting list at the Evening Reporting Center. In April of this year, Dr. Damui will be concluding his one-year evaluation of the program, and that's very exciting because we'll have a full year of data to be able to see exactly how the Evening Reporting Center is doing and compare to other youth who are not receiving the services from the Evening Reporting Center.
It's a good program. It looks like it's working. Things are doing well.
All righty.
That's good.
We're ready for a motion. Thank you very much.
Thank you.
Very good.
It's been moved and seconded. We're ready to vote.
Thank you for good work.
And our final item, Public Works.
Those are good, finding things that
Stop the
keep them
clock
out of jail and do it
until
the right way.
we get this done for APC. Item 30.
Morning, Chair Bennett.
Are we talking about the Dersey Center here? Is that what we're talking about?
Mr. Powers. The item before you is approval of a resolution intention and direct publication of a notice to hear whether or not to purchase real property located at 101 West Cochran Avenue in Simi Valley on April 8th. The proposed use of the building would house mainly the Human Services Agency that's currently located in 4 different locations in Simi Valley, but there's sufficient space that other county tenants would be available to use that space. If there's any questions, I can answer those.
No, just a comment, it's a beautiful building.
Yes, it
It's
is.
going to be a real nice building. They can do some filming in there, it looks like, too, if they want to. I know Mr. Grosko will probably set it up that he can do all his filming in there.
We'd have to buy our own equipment. They're taking all that with them.
They're taking that equipment with them, okay.
And a remarkable rate, right? Cost
Yeah,
per square foot?
it's a very good building.
Yeah, that's great. Good, wonderful.
All right, great.
Okay.
Oh, we do have a
One
speaker. Willis Sandmeyer.
I'm here to speak against the sale of this property to the county. I don't think it's a good buy for the county, and I want to tell you why. In full disclosure, my husband manages this facility. It's an excellent broadcast facility, but I don't think it's really well suited for your needs as office space. In fact, in just the last several months, there was office space just across the street that sold for $42 a square foot. You're going to be paying $120 a square foot. That's nearly triple the price. What this is a wonderful media facility. The city of Simi Valley, in fact, is very interested in keeping it as a media facility to be sold, not to be purchased by them. It currently houses 2 different television studios, 2 different radio studios, and has a satellite facility that is currently, as we speak, keeping track of 6 different satellites with programs that are being broadcast 24/7. I think this is a beautiful building, but I don't think it best suits the needs for the county as office space. I really appreciate how at Ventura County, unlike other counties in California, we are very frugal and we make good financial decisions. That's also how I run my own household. And while, yes, you may feel this purchase price is good, I don't think that it fits your needs. I also found it interesting that I was told by someone inside the building that they had been told that a representative of the county had promised them they could deliver a contract tomorrow. A final vote is not taken until April 8. So I couldn't quite understand that, and we don't need to go any further detail in there. But no one can deliver a contract until the board makes a final vote, which is not coming until April 8. I appreciate the fact your staff has done a lot of research on this and that someone else feels that it is a good decision, but I would ask you to delay a vote on this and do further research to find a property that would be a better price per square footage and would better suit your needs. Thank you very much.
Could you please respond? Are you aware of these?
I'm not aware of the property that's sold at $42 a square foot. That would be a low price in the entire county, as far as I know, is for office space. This building does have 97,000 square feet of office space, and the studio warehouse space is around 25,000 square feet. So it's mainly an office building that has warehouse and a small studio in back. The property was the owners did try to market this property for 2 years as studio space, and they were unsuccessful in doing so. They were unable to find anybody that was willing to come to Simi Valley to run a studio from that location. I will certainly chase down the $42 a square foot, but I doubt it would be office space that's anywhere near comparable to ours.
Could you fill us in, Mr. Filigar? Right now we have approval of a notice and resolution of intent to purchase, which is not the actual purchase. From the standpoint of investigating the speaker's comments and still not interfering with our negotiations and the process, is it possible for us to take this action, still investigate it, and we still have a final yes or no decision to make later? Is that?
Yes.
Okay.
There's no commitment on our part until the board hears the matter on the 8th. Mm-hmm. So I could come back with something in the interim with regard to that sale if you're interested.
And so what does this notice do today?
We're required by state statute to notify the public 21 days prior to actually taking the action to purchase.
Okay.
So we have not even completed a purchase agreement at this point.
This really has done exactly what the state wanted to do, which is to make sure the public is notified. So, Ms. Sandmeyer, if you have other comments, I saw you shaking your head, but if you have other comments, you heard Mr. Filigar's response. Rather than us debate that here, we have our APCD. You're aware that he's he was saying something you were disagreeing with. You've got, it's easy to, by email, to contact all of us. The email system works the same. It's the supervisor's name, dot, their last name, and then it's at Ventura. So we can hear from you, and Mr. Filigar, if we could hear back from you, as we look forward to hearing your recommendation as we go forward. But my recommendation to the board is that we we actually do the notification here so that we officially meet state law, and let this be investigated over the next 21 days. And then also, I'd like to hear from the agency in terms of why they think it is the appropriate building for them. If the contention is made it's not a good building for them. So I'd like to hear from the agency also when that time comes. Not right now, right?
Okay.
But as we move forward. Okay.
Could I also ask regarding the square footage cost, how that compares? How does this building compare with the region?
In the letter it said lower, right?
This is a vacant concrete tilt warehouse. Cost to construct is around $108 or $110 a square foot. So we have built-out office space in here. We're slightly above replacement cost new.
But if you were to go, well, I'm just saying in comparison to what's out there in price, that's already existing, because that's what I'm comparing it with. Other
Okay.
buildings that we could purchase as $1.20 a square foot low.
$120 a square foot. We looked at a lot of different buildings. There was nothing at this price except something that is very large, which we did investigate. We could have got that for a cheaper price, but it was more space than we could feasibly use.
He's talking about the farmer's building, which is probably going to be at 80 to 85, maybe $90 a foot, depending what the price is.
Put us into the landlord business.
Yes.
It turns into 240,000 square feet versus.
Any other questions? All right. We're ready for a motion, if you can let us do that. All right, it's been moved and seconded.
Thank you.
Appreciate your comments, Ms. Sandmeyer, and we'll look forward to an interesting 21 days here as we hear about this. Right. All right, APCD, thank you for your patience. Time certain item on the general fund. Mr. Dursey.
Thank you very much, board members. Paul Dursey from the County Executive Office. Myself and my boss, Mike, will go over this presentation as soon as we get it up. And be ready to answer any questions that you had.
We'd be happy to answer any questions.
Yes. Okay. That was nice.
Very good. Don't have all the clock.
Everything's good.
Everybody
you told us to be efficient.
That county budget was a black hole. Right?
That's right.
That's,
that's
like
right.
Now, huh?
Is there anybody up there?
It gives us something to give Brian a hard time about.
We're going to go into temporary recess here due to a missing booth. Project this up there, but it means the public looking from the outside, they only see the seal. They don't see that. But so for the benefit of the public that's listening to this, there is a PowerPoint slide that's up, but due to technical difficulties, we can't show that right now in front of the board. That's right. That's what Brian is telling us. I think it's because he's...
Will it show up in the archives?
Wait.
This is not the final budget. This is just a target budget. Number one. Number two, we were talking a minute ago about just going from this with nothing up. We have something up for the people in the room to be able to watch. Well, we have two votes to wait. My vote would be to go forward. That's two. Supervisor Zaragoza? Go forward? All right.
Because this will be available at some point for people to look at once this thing comes up, right?
Posted online.
But can we post the PowerPoint online?
But
Yes.
but they will hear verbally what he says? Okay,
So
we
let's
got
post
it.
the PowerPoint online also for the benefit of the public. And as soon as, I mean, we may have this booth man or woman show up sometime soon here, right, while we're doing this. So go ahead, Mr. Dursey, let's start us off. We have people waiting for the 1:30.
I'll let Mike kick it off.
Oh, okay. Well, thank you. Yeah, so the budget process for fiscal year 14-15 is off and running. Paul and budget team, as well as the
Is
department.
this a sign of how things are going to go? What's that? We're off and running, and this is the...
Yeah, this is it. See?
This is how
It's gonna
well
be a
things
piece
are
of
going to
cake.
go with this, right?
See how efficient and effective we are? See, lower the expectations.
That's right.
Then you go higher.
That's right.
It's all part of the strategy. Of course, these are your board's guidelines, as you know well. That fiscal discipline and commitment to a balanced budget has led to your outstanding credit rating. Reducing overhead and ongoing savings also essential. On the transparency piece, I want to emphasize that. And part of our goal is to give you information, your board and the community information, early enough so there's time to consider it. And for that reason, we'll do the capital projects budget, I believe, in May, as well as have the departments come one at a time, so you have enough time to hear how they're doing with their services and what budget challenges they're facing. So with that, I will turn it back to Mr. Dursey.
Right, and this is just a recap of the budget reports that we generally present to your board. First quarter, on November 5th, we presented a board update for the first quarter. Internal service rates was on February 25th. And then budget development manual last week, and this week is the budget, actually today obviously is the target budget information, and next week our second quarter budget update for the current fiscal year. So these are generally budget reports we made to your board, and we continue, and as we go through, we'll point out the number of budget reports we'll continue to make throughout the year. Budget process, this is generally our process. We try to determine how much it's going to cost to maintain our current service levels at next year's cost. And then we develop our what we call net cost target budgets, and then we meet with the departments on those budgets, and we're in that process now. So we're meeting with departments relative to what we think we can afford to allocate to those different departments, and we'll give the departments an ability to get with your board and make a presentation to your board in the April and May timeframe. Our capital long-term debt presentation will be in April. Five-year forecast will be in May, and in conjunction with the five-year forecast, we plan on making a presentation regarding retirement costs, retirement rates, future retirement rates as we see them going forward. A preliminary budget on June 3rd, and final budget hearings beginning on June 16th. Overall key budget assumptions. Secured property tax, 2.7% increase over the current year. That's what we're assuming at this point in time. It's a little on the low side relative to the price of houses, et cetera, but we only have a 0.45% CPI increase on the secured roll for this year. So the remaining amount is really going to have to be made up. The additional 2.25 will have to be made up with increases from the roll, increases from reevaluation. So we think that that's a relatively good number at this point in time. We've worked with the assessor, and he's comfortable with that number at this point, again, at this point in time. So as we go forward, we'll refine that, and we hope it goes up, frankly.
Mr. Dursey, could you just fill us in on what are the impacts of it only being 0.4% in terms of the CPI and how
Right.
that
In general, if you're a Prop 13 base valuation, your value can go up to 2% a year increase. This year, and it's based on the CPI from October to October. Well, this year's October to October CPI that the state uses is 0.4 rather than 2 or above. So we're short a little bit relative to that CPI.
So everybody whose homes are fully assessed right now could conceivably have gone up by 2%. That'd be the Prop 13 cap, but only if the CPI would have been 2%. But since the CPI was not 2%, they're not going to be going up by 2%. They're just going to be going up by 0.4.
That is correct. So if you have a home, you've owned a home for 30 years.
And how about the people that were reassessed lower? They can come back up?
Yes. If for example, you had a house that you bought for $500,000 a number of years ago, and it was reassessed down to $400,000, and that's its base, it could go up, and let's assume again it's worth $500,000 now. The assessor can reassess it at the $500,000 plus that 0.4%.
Right.
So you could jump 25% in a year very easily because you've been cut by that 25%. And that's the majority of that 2.7% increase is those revaluations.
Right, thank you.
But the .4 is the savings for the individuals at the Prop
Prop 13.
13, yeah.
If your base is Prop 13 number, then your property tax is only going to go up by 0.4%.
So there's a savings there.
There's for the homeowner, definitely.
For the homeowner, yeah.
Yes, relative to the potential 2% increase.
Yeah, okay.
Yes. General fund, general purpose revenue, we're estimating about $340 million next year, and it's about $14.5 million more than the current year adopted budget, and it's about 4.5% increase. You see, that's quite a bit different, quite a bit greater than our 2.7% from secured property tax, and a big piece of that is due to our reanalysis and reestimation of the RDA funding. In the current year, we had like $16 million estimated, and we're expecting to be in $19 to $20 million range next fiscal year on an ongoing RDA pass-through revenues. We initially started out about $13.2 million of RDA pass-through dollars, and then the state adopted eliminated RDAs, and then we estimated our share to be, for this fiscal year, about $16 million of ongoing revenue. It actually is a lot higher than that under our current scenario, because we estimated back last year about this time, we estimated about $16 million. It's a lot higher than that this year, and we're expecting it to go a little bit higher next fiscal year. So that's a big chunk of that, actually, about $3 or $4 million worth of the increase. So that's why the secured property taxes are actually a little bit less. Usually the majority of our dollars are secured property taxes, and they're only going up by 2.7%, but our overall general purpose revenues are going up by a greater amount. So the RDA, it's kind of one of those accounting issues, but the RDA revenue is not considered to be property taxes. It's considered to be aid from other governmental units. So because it's the way it works, it goes to another governmental unit and comes back to us, so that's how it's accounted for. Although in our big picture, when we say not about 90% of our general purpose revenues are property tax based, we don't go ahead and add that back in as property tax based revenue.
And RDA's ongoing revenues.
Yes, those are ongoing.
If I can ask you, Paul.
Sure.
That's not going to be, that's ongoing regular, not the one time when things are sold or anything like that.
That's correct. That's ongoing. We do expect some one-time dollars next year, but it's hard for us to project those dollars because we don't know what will be sold by each city each year.
But we know there's some things out there.
We do know there are some things that will be up for sale, and we will get our roughly 25% proportional share in the general fund.
But over the next 2 years, probably 3 max, that all those will be sold off and that'll all go away, right?
Correct. Then the one-time dollars will go away, and as the ex-RDAs pay off their debt, more and more dollars will be coming to the county in that regard. So there is an incremental increase on an annual basis in RDA pass-through dollars until the final disposition of all the RDAs.
So to be clear, the one-time dollars will go away, but the annual RDA money will continue. Will come in and continue to grow.
Yes, continue to grow.
Because the RDAs that had debt use the money first to pay their debt, and then what's left comes back to us.
That's correct.
Okay, so.
And once they pay off all their debt, then we get a bigger portion.
Okay.
Prop 172, which goes to the 4 public safety departments, 5 including our contribution to the fire district. We're expecting it to go up about 4% from the current year adopted budget, about $64.5 million. I guess the good news there is that we've actually, for next year, we're projecting an increase in our actual statewide allocation. So that's our I think it's $62 million that we've estimated for this year. We're probably going to be a little bit higher than that because of the new calculation of the statewide apportionment. And that's based on the 2012 actual CITUS sales tax for Ventura County, our proportional share relative to the entire state. So we do expect that proportional share will go up a little bit next year, so that's good news. So we're very comfortable with the 4% increase in our Prop 172 sales tax estimate. Health and welfare realignment revenue, primarily sales tax based. Part of it is as VLF, vehicle license fee based also. That we expect to go up to be between 4% and 5% relative from this year. And Prop 172 fire contributions, we are anticipating to be about $2.3 million out of the 172 funds. And we've included our realignment revenue, 2011 realignment revenue that we're associated with the costs that are currently ongoing.
The $2.3 million for 172, has that changed from the past?
That's gone up a little bit. It's proportionally gone up by the amount, about, I would say, 4%.
When you say the
Increase.
2011 realignment revenue included,
Yeah, that's included in this target, in our target numbers. We've included costs and revenue associated with the 2011 public safety realignment.
and is that growing?
It's growing a little bit. But right now, in our public safety number, we've only included enough revenue to cover current costs. So if it's going up, it's going to cover additional costs or potentially additional programs. But if it goes up a little bit, then we'll see a little bit of increase in some program activity rather than, let's say, bottom line savings.
Great,
If that makes sense. On the expenditure side, salaries, all the negotiated salary increases are in there. We've also made some assumptions on the not yet completed negotiations, so we made some assumptions in that regard also. But we have included COLA increases really for the first time in a number of years for the employees on the salaries. Retirement rates increased. Those are the total combined costs. County costs going up from 26.63 to 28.21%. Normal cost has actually dipped down, 1/100%, and that's just, I think, probably a rounding situation relative to the actuary. The UAL cost increased by about 1%, a little over 1.5%. So the UAL cost is where our costs are going up. Just as a point of reference, a normal cost for until they did the actuarial evaluation in 2011, that normal cost was about a little over 1.25% less than that number. So it was probably in the 9.7 range, right in that range. So that actuarial evaluation where they did the demographic analysis, that increased our normal cost well over 1%, and that's just a county share. It also increased the normal cost for the employees by roughly the same amount. Controlling overhead costs, I think we've talked of this about quite a bit. CPI increases, service and supplies. We've required the departments to absorb all those cost increases. We have not allocated an additional budget number for a department for service and supplies COLAs, CPIs, over the last 3 years. Fortunately, it's been relatively low environment for inflation. So over the last 3 years, the departments have absorbed almost a 6% overall increase in the CPI.
And we're projecting no increase again?
We've allocated no increase. It's not that we're not projecting, but generally speaking, and we call it the 2000 level, the service and supply level, we have not allowed an increase for that CPI.
Is our intention to bring that to an end at some point in time and start to allow some increase?
Probably, yes.
When?
Maybe next year, maybe the year after. When we get a real good flow coming in. I think realistically, in our 5-year projections, I believe we've included it next year or the year after, if I recall.
That's correct. Yeah, years 4 and 5, we showed an increase.
Okay, yeah. I mean, I really appreciate what we've done, but at some point in time, you can't do it forever.
Right.
And
We're reaching the end at that point.
Because, all right, great.
And part of that is frankly because the ISF rates have been really flat and actually ticking down. So that's helped the departments a lot relative to their 2000 level. Because if you have one cost from ISF that's going down, that means you can afford, if your funding is flat, that means you can afford an increase in another area for services and supplies. So that's actually helped the departments quite a bit. Recurring rates, $10 million a year. I think that's been discussed a couple weeks ago. $31 million total savings over the last three years plus our target year. Here's our general fund target budget compared to the current year adopted. See the appropriations at about $20 million more, with direct revenue not significantly greater, about $5 million. The real key thing there is the general purpose revenue going up by almost $15 million, $14.5 million. So that's the key driver as far as our target appropriations. We know that when we start fine-tuning the budget, getting more information from the departments, generally speaking, our target budget is based on our estimated amount of general purpose revenues. That number won't change significantly between now and the budget year and the adoption of the budget, but the departmental direct revenue will change up and down as Human Services Agency gets more information, for example, what their contribution from the state will be and the federal matches on different programs, those types of things. As we go through the budget process, certain programs will be added, certain programs will be reduced. We know, and we'll get into a little bit of discussion on the KDA program, for example. We know that they're going to start ramping up. We'll include a ramp-up portion of that, but that's not included in the target budget at this time. But
Mr. Chair, Paul, and our target is what percentage that we're looking at for the...
The target budget is the $941 million, $942 million on the
and
upper
the
right.
percentage on that? What's the percent of that we adopted?
We adopted for the current year 921. I think it's about I would guess it's a 4% increase. I don't know. I don't have that particular number. We can calculate the 941 over the 921, so that's whatever that number is. That's a percentage increase.
The net cost going up by roughly 15 million, 14.5 million, right? Can both general purpose revenue and direct revenue help with direct cost, or is it just going to be direct revenue?
Both. I mean, your board can allocate anything you
Right.
want toward the direct cost. I mean,
Right.
if you say we don't want you to cover a program with direct revenue, you have more than enough opportunity to cover it with general purpose revenues.
Okay.
We wouldn't recommend that necessarily,
Right.
but
So, but we got essentially 15 million in net cost increase, and we've got 20 million in revenue increases.
yes, overall, yes.
Right. Okay, got it.
At this point, we would expect the numbers to go up a little bit actually as the budget progresses, but the numbers that go up will probably be the appropriations and the direct revenue numbers. This is the net cost actual for last year end. We actually had a little bit of a profit last year. That's what the negative is. Net cost for the current year, the $325 million, we budgeted zero. At the bottom line there, total general fund, we budgeted zero. We allocated our entire amount of general purpose revenue. And this is our target for next fiscal year at this point in time. You see the general government target's about $805,000 above the current level. Basically, what we did is we allocated the $14.5 million additional general purpose revenues and allocated those to all those different program areas. See, the majority of it is in the public safety area, $8.5 million. That is due to the 4088 calculation, and we'll go over the 4088 calculation as we go through the presentation. But bottom line is we are balanced with, at this point in time, no service level cuts, no layoffs. So I guess that's overall a decent position. And we expect going forward that, again, the numbers will change, but the bottom line of being balanced won't change.
So another way of saying this would be general purpose revenue is going to grow by 14.5 million, and public safety is going to get 8.5 million of that 14.5 million.
That's correct. Here's the actual appropriations, how we've allocated just the appropriations of the $942 million appropriations. You see public safety, the green one on the left, and the bottom right, the red one is health and human services. Those are the majority of our spending. The overall appropriations are public safety and health and human services, both safety nets and public protection. Here is the same general fund target appropriations, $942 million. This is just a different picture of majority of it. $563 million of that goes to salaries and employee benefits. So, we are driven by the employees' costs, frankly, and a portion of those goes retirement. A lot of it goes to just straight salaries. A majority of it actually goes to just straight salaries. So, $563 million of our overall costs go to salaries and employee benefits. We see we have a little tiny sliver up there for contingency. That's $2 million. In other are, for example, there's debt service in there. There's aid payments that are in there. Those are all flow-through dollars, but there's aid payments, those types of things. So. And this is our target contributions. This is our general fund net cost, our net cost allocated, our general purpose revenue, how we've allocated it to the various departments. We put the percentages up there. 59% goes to public safety. This is as compared, again, this is kind of compared to the overall target appropriations. The target appropriations, notice that Health and Human Services has 362 and public safety has $378 million of appropriations. And then when it comes to actual cost, the Health and Human Services is significantly less because of the dollars that come in from federal and state funding areas. Public safety doesn't get nearly as much for direct service charge, so a lot more contribution from the general fund is needed to support the public safety services.
I'm just trying to work my brain, make sure I'm getting this right. So you could say basically they were both about 370 million, right? Of the 370 million, we fund 59% of that for public safety. We only fund 11% of that for Health and Human Services.
Well, no, not that.
Oh, no,
this is
59% of our general fund contribution goes to public safety.
That's correct.
11% of our general fund contribution goes to good.
Correct. Now, if you go back to these numbers here, this is where we show that $199 million goes to public safety out of our
37 million.
So that would be out of the 941 million.
So you could take those numbers and you say those two numbers leverage about $370 million worth of service in each one of those.
That's
cost us $198 million to get $370 million worth of public safety services. It cost us $37 million to get $370 million of Health and Human Services.
That's correct.
Right.
That's correct. So there's a little bit more leverage in the Health and Human Services Department. This is just a quick discussion on our 4088 calculation. It's a formula-driven maintenance of effort adopted by the Board of Supervisors a number of years ago. We track it every year. It's based on the ability to pay, which we track, which generally speaking is our increase in our general purpose revenues, or a formula-based entitlement, which is a calculation that involves a number of different 10-year average increase in actual general purpose revenue. So we calculate that every year. And this is how the numbers fall out into our calculations. The middle number is, if we calculate every year, we calculate the ordinance formula-based entitlement. If they being public safety got the full allocation of formula-based entitlement, it'd be $201.4 million that we would be allocating to that department, to those departments this upcoming target year. What we're actually allocating is $199 million. So we're just a little under what our formula-based entitlement is required overall. So we'll be working our way back toward that formula-based entitlement number as the years go on. And the ability to pay number is $199 million, which is the exact same number as our target. This is the Ordinance 48. This is the long-term graph that we've tracked, again, the contributions relative to the 4088 versus what the departments actually got as a contribution from the general fund. You see in the beginning years, or let's say 5 years ago, there was a significant amount more allocated to these public safety departments that was required under the 4088 settlement. So overall, right now, if you look at the far right, the number is pretty close. That's that $2.1 million difference between the 199 and the 201 million. So we're very close to being right at the 4088. But over the years, during these years, we're giving significant amount more. The total net is $54.4 million that's been over allocated. We're $2 million short this current year. Over the 10-year span, it's been about $54 million
So Paul,
in excess.
that was the recessionary years, sir?
Yes, those were the years when yes, it was during it was a growth years. It was growth years at first, so we had some money to allocate to them, and then the recession, and that's the recession hit, and that's why we kind of dipped below the amount.
And now we're getting back to normal, and hopefully maybe headed by 14, 15.
That's the goal, is to get back to that number, correct?
And again, the 54.4 million represents
that's
total amount of over.
That's the total amount that the county has contributed to those 4088 departments in excess of the formula-based entitlement, correct, over the years. No, it's from our general purpose revenues, our allocation of general purpose revenue. This is independent of Prop 172 dollars.
Our portion.
Yeah.
Yeah.
This is the assessed valuation. Again, over here on the far right is our estimate for next year at whatever 2.7%. The rolling 10-year average is the green number, just to say that it goes up and down. But the problem with this blue line is pretty volatile, so it goes up and down. See, the yellow here is 0. We had a couple years that were negative, so we were reeling a little bit back in 2009-10 timeframe. So we're back above 0, which is good. And we would expect, long term, and we'll get into this a little bit more when we get into a 5-year forecast, but long term, we would expect that number to come back here higher as far as long-term averages in the 4 to 5% range. Prop 172 revenue, we're actually finally above where we were back in mid 2000. So that's good news. And this is the target number. This is the $64.5 million that we had talked about earlier. So the good news is that Prop 172 revenue is continuing to go up, and that clearly helps our public safety departments.
That's basically sales tax, right?
Yes.
So that would be the same line if we were just looking at a sales tax over time. It would just look like that line.
Generally speaking, for Ventura County, each city would be a little differently, but this is the county as a whole. That's correct. Here's our unassigned fund balance number. You see the yellow line at the very top is our goal of 15%, which again is roughly equivalent to about 2 months of appropriations, 2 months of cost. 15% is ultimate goal. We're about 11.8 in this current budget year. We expect that number to maintain based on our current analysis of the current year, but we'll get into that a little more detail in a couple weeks.
In order to do that, how much do we have to put back into that fund in order to keep it that 11.8?
Well, whatever 11.8% of the increase of $40 million. If the revenue goes up by $40 million or
so
the
it's going to be about $5 million.
Yeah, exactly.
And you had?
I think it went from 940 to 920 to 960, if I
I
recall.
thought it was 20.
Up by 40 million, I think.
But it's about 11 point or 12% of whatever
920 to 940?
that
Yeah,
budget
920
has.
million, 920 to 940.
Okay, so it's $20 million?
Yeah,
Okay, $20 million increase. I was thinking, okay, yeah, so $20 million times 11%. So it's about $2 or $3 million increase.
It's a little over $2 million. Okay.
Yeah. Here's our impacts. We can,
I'm just going to emphasize that.
Go ahead.
Sorry to interrupt. That this last year, given that the increases in positions due to the Affordable Care Act and safety realignment, that increased that denominator. So that could have actually, if we kept going at the pace to increase the reserve, it would actually have reduced your percentage reserve, but your board didn't do that because of the amount you contributed. You managed to continue it, to increase it even despite that increase in the total appropriation. So very positive.
So it would have been more?
If you kept contributing the way you were, the percentage would have gone down. Yeah.
I'm going to say this early in the process that my interest is in maintaining our percentage, which means we grow our reserves, but I'm not trying to, I think trying to grow our reserves to the 15% is not the realistic goal at this point in time. I think we'll be doing very well just to maintain at 11.8%, which means we have to come up with more money for the reserves. So we have to grow our reserves by the $2 million.
It is a good goal. It's just the time frame of when we get to that goal, but I still think it's a good goal.
Well, I don't say it's not a good goal, but going
Keep
back to 2000 when we were at 0, it was just absolutely urgent. I think the urgency decreases as you get closer to 15 and start to look at other things.
But it's also one of those things, if you don't continue little by little,
I agree.
It will be
You got to be
harder and
focused on the
harder
goal.
And just, I did actually calculate some numbers I have here the current 11.8% is of $921 million budget is $108.4 million. That's the number in the blue line is $108.4 million. 15% of 950, I just rounded at 950 million, is $142.5 million. So in order to get to the 15% level, we would have to increase it by about $34 million let's assume next year. If our budget was $950 million next year, we would have to increase by roughly $34 million to get that. And clearly that's not doable in next year, but over the long term, as we continue to incrementally, if we're required to put in 3% to maintain, or $3 million to maintain the 11.8%, if we can put in 4 or 5 million, then that incrementally we will get eventually to that 15%, and that gives us a lot of flexibility.
But that's a great analysis, because we still got to get $35 million in there, and then every year on top as the budget goes, we got to find ways to keep adding just to stay at 15% at that point.
That's
So
correct.
I think Supervisor Parks is good. Correct. We got to really focus on keeping that focus on getting to that point. Huh? You're good too?
So, yes, on point number 1 there, we'll see that we're at 11.8%, and your board has clarified the goal of 15% there, so we'll refer to that. What's that? On the capital requirements, just to point out there, again, your board is, unlike some counties, many, not dipping into its reserves, maintaining and increasing, and you're also not scrimping on capital projects. You're continuing to invest in IT and facilities projects, which are critical to our future success. Just to skip down there, too, a couple big things that we're continuing to watch, as you know, is realignment, both safety realignment and health. And in health realignment, we know there's kind of a complicated deal that was worked out, and has to do with the Affordable Care Act and potential savings. So we're going to watch that closely, make sure the county's getting its fair share. And also on safety realignment, being very clear with the state about, are they funding us adequately in our safety departments and our social and health services departments to meet the demands of safety realignment? And we've reached a point now where they're not adequately funding that. So that's something we'll report back to you shortly. But
I believe we are funding something like 59% of all the public safety, if I recall that number. And my question is, how has that number done over time? Are we doing a bigger share into public safety, or are we getting more realignment money so it's reducing our costs?
The actual percentage of the general purpose revenues are allocated to the public safety departments has gone up over the years to 59%. And over the last couple of years, it's been 58-59% over the last several years.
So it has been climbing.
It has. I think it started out initially at the 55-56% range.
So I would think with the realignment that we're getting more funds from the state, but that's not enough to change that.
That's correct. Well, yeah, that realignment has just been in the last year or two, and that's just for their increased service levels, frankly. And most of it's been, we've gotten, let's say, $15 million of realignment, and we've got $15 million of new costs. And that's just really to offset. Actually, we have more than $15 million of costs, but that's for a different discussion, so to speak.
Yeah, and that's the point we're getting to, is that we've started to go over a little bit what they've actually given us for safety realignment.
And so that's this whole push that all the counties are doing to try to get the real money that they're doing. But also with our new contract today that we talked about with that cost sharing, which will slow down that increase, since public safety is the larger increase of the pension costs, right?
That's correct.
It'll be shared a little bit more to help slow some of that.
It will certainly be, it will be very helpful if they happen to change actuarial assumptions again. Those types of things are really detrimental to the normal cost.
Yeah,
then those are very costly. We think in general, in the long term, our retirement system is in relatively decent shape, frankly, and we expect the unfunded liability and the funding share to continue to increase. It went from 79 to 8. We expect it to continue to go up over the next several years, and to be pushing that 100% funded over the next 7, 8, 10 years.
And if that continues, that'll shrink some of that portion of that $100 million that we're paying.
Yes.
It'll decrease that more. And a lot of that's public safety, so going back to that number of public safety continue to grow to 59, 62, 60, hopefully part of that cost, right?
Right, and we'll be able to maintain them at that 59% level.
Exactly, yeah.
And hopefully it'll free up dollars for them that they don't have to spend on retirement contributions.
Because there's going to be other services required. Good,
That's
good,
correct.
okay, great.
I might add too, you're looking at key potential future impacts. We're asking for a study, but it's quite possible that if the initiative passes that's out there on changing their pension system, that could have a tremendous impact on our future finances.
I would say
in the short term, particularly.
Yes, I think in the short term, the budget costs will go up in the short term. Long term, it's.
Yeah,
I don't want to say this out loud.
That's what the studies, but I'm just saying that is, a bullet point right there, because that is a a potential threat to our income at this time.
Yeah, it is a short-term impact from a budgetary standpoint, correct. The other, I just want to point out the grants, for example, behavioral health came with a grant today, $7 million. Those are issues. Those grants are issues. Grants are great, but grants also sometimes go away. So again, our departments are pretty good at getting those grants. We want to make sure that they follow up to make sure they continue those grants. And board policy, if the grant goes away, the program goes away. That's sometimes a little more difficult when they're really good programs or fundamental programs. So our departments, like I said, are very good at that. The other thing is the last item on there, we have KDA. That's a relatively new mandate coming down from the state, and we are calling it a mandate from the state at this point in time. But potentially, potentially we're looking at ultimately an up to an $8 million program, and under the current scenario, that would have to be half funded by a county general fund. We're pushing hard with the state to try to get the state to make sure they kick in their share, but that's right now we don't know, frankly. So we will be including in our. It's not in the target right now, but in our preliminary budget, and ultimately we will have some ramp-up dollars for the KDA program. And hopefully, we expect the state ultimately to have to pay their proportional share. But
and this is hope. This is the program that was directed by, I believe, the federal courts. That's basically requiring increased mental health services for foster children, increased assessment and services for foster children. And certainly needed. Some services are being provided, but there is certainly much more that could be provided. So really the directive is out there now, and the departments are being very responsive and active, both behavioral health and HSA, in ramping up and developing the programs that are going to be required. So we're going to include some funding in next year's budget so they can get started, and we can assess continually how it's going, what their needs are, and so forth, and try to maximize reimbursement.
That's going to be mandatory?
Yes.
Yeah.
And when will it be fully implemented, you think? Take a year or so to do that?
That's our best guess right now. It's going to take a while to ramp up, that's for sure. And clearly, overall, the plan is to start it up, kind of ramp it up a little bit over the next 6 months, and then have behavioral health and HSA evaluate and see where we are, and come back to your board sometime next year, in the fall, for an update of what the program is, what the costs are. My understanding is that they'll be coming in the beginning of April with the board letter. Right. They've already been once or twice to your board relative to the overall big picture program, but now we're starting to get into what this thing is going to cost us and what we need to do to implement the program.
And maybe you don't know this, or Supervisor Long knows, where's the rest of the counties on trying to do exactly the same thing, get at least half of it paid, or or more of it paid?
Same thing. The CDWA and the welfare directors and the mental health directors are all working hard. Our own Sue Hughes is working hard also with trying to make sure that the state is aware of the issues, obviously, and to make sure that they are held responsible for their share of the programs. Because right now they've issued the program mandate, so to speak, and it's not inexpensive. Let's put it that way.
Mm-hmm.
Didn't we used to also chart was it a SB 90 or something, the money that the state owes us?
Yes, we still have that number. It's still in that $30 million range.
Yeah, I'd keep it in the budget presentations.
No, that's a good
right.
point.
We can do that, and that would be a beautiful thing from our standpoint. Is that if the state would give us that money, then we would be at very close to that 15% level, and then
there you go.
So anything your board can do to help in that regard, we'd be more than appreciative.
Well, it is one of the things that CSAC has put on their priority list, is to start working that with the leadership and the governor to get those monies back to counties.
Right.
We're not the only ones sitting there with an IOU.
State budgets do.
So it is. Right.
Yeah, I don't know if you saw yesterday, they had a report from the state controller about where the state is, and right now they're $1 billion above what their projections were for next year's budget. I mean, in next year's budget, they put in what they expect for the rest of this year, and the month of February is $1 billion higher than. So that $1 billion is about what they owe statewide. So anytime they want to. Yeah.
Right. That's right. Piece of cake.
And this is, just the overall, this is the budget plan. This is where we are as of today. The target budget is balanced. And we will continue to work with the departments relative to cost and efficiency efforts. We will be working with and regular updates to your board, capital projects, 5-year forecast, departmental presentations, and continue to work with the departments developing their budgets, and of course, ultimately, the preliminary budget and the budget adoption date. And more than happy to try to answer any questions at this time.
Mr. Chair, I just want to share that initially you mentioned that we have a balanced budget, and the important thing is that we're providing the services to our constituency, and also that we're not going to have any cuts in personnel, any layoffs, and we continue to look for cost savings and efficiency efforts throughout the agency. So I think it's an excellent budget, and I think we're in the right direction. So I thank you for the excellent presentation.
I agree, and and like I said, you took in these account of the increases, salary increases, and people are doing it. So hats off to all the people that are working hard to save every dime they can. So we don't have the layoffs, we don't have all those things, and we can still do the things good for the employees and still provide all the services. So it's good work.
That's it.
Motion
Thank you.
So move.
Paul, if we put
Thank you very much, Mr. Durson.
Thank you.
If we put a 10% commission on that $30 million, you get that, Paul, for sure?
All right, we're at our final item, our 1:30 item, and that is a receive and file above and beyond presentation by the Ventura County Libraries Agency. Oh, we still have board comments, that's correct. Thank you. Yeah. Finally.
Distinguished Board, Chairman Bennett, CEO Powers, we want to thank you for giving us a few minutes so that we can share with you about the library's commitment to public service and how we have changed our focus. We've changed our whole service model in order to refocus on the things that are of priority to us. Now, like most libraries, where people think that we are a little out of date, we needed to refocus on the things that were important to us. And so, in our refocusing our priorities, we wanted to make sure that all of the resources that we provide are easy to access. We wanted to make sure that we empowered our staff to go out above and beyond, outside of the brick and mortar buildings, to do things with the community. And 3, to engage the community in the things that we do best. And this fits in right with the county's strategic plan. Our goal is to have leaders in our staff to be creative and innovative. One of the ways that we started this was at our online catalog, our web presence. We want to tell you more about those changes that we have made.
Thank you. Good afternoon. I'm Barbara Eels. I'm your web librarian. And I have a short, quick story to tell you about how Ventura County Library has expanded their services beyond the brick and mortar library buildings. Ventura County Library serves its customers online wherever they are. Our customers have the library at their fingertips. I have a short story here. As I mentioned, here are our residents. They've just taken a couple of tables at a coffee shop after viewing a late night showing of the recent movie Mandela, Long Walk to Freedom. They're very inspired by Nelson Mandela's story, and they want to learn more. And one of them says, "Hey, let's go to the library." That's a great idea. Our library has great resources for further learning. And they all reach for their individual devices. Some have smartphones, others have a laptop. From our website, vencolibrary.org, which pulls in over 500,000 hits a year, our customers can find downloadable ebooks, downloadable audiobooks, free music, online magazines, free movies. They can also access database resources, which include business resources and genealogy resources, streaming video, and podcasts, all of which are viewable on both mobile devices and personal computers. For our customers who are less comfortable with mobile devices and computing, we also have online help, mobile programs, and one-to-one guidance. Our Ventura County Library customers have the libraries in the palm of their hands. They have them at their fingertips. They can take the library with them wherever they go. Ventura County Library, you can now go to the library wherever you are. Thank you.
I am Mark Lager. I am the IT manager for the county library system. And so much of this runs on our technology. We have slowly increased all of the things that we needed to do. Now, as you can see, we centralized a lot of the processes that we were done. As we did in looking at our processes that we currently are doing, we use Lean Six Sigma principles like define, measure, and implement to change the way that we currently are doing things. So we centralized. We put in self-check machines, self-service machines, RFID, radio frequency identification, all with the goal of being able to free up our staff in order to move beyond where we currently are. And so we want to talk about three specific areas where we have made changes to our service model. The first is literacy. The second is community outreach, and the third is empowering our staff. Now, literacy is at the very heart of who we are. Very heart. That's who we are as information professionals. As you know, from kindergarten through third grade, the emphasis has always been on learning to read. Small words, picture books, phonics, sounds. But then at fourth grade, the emphasis changes to reading to learn, where those small words become larger words, sentences become paragraphs, paragraphs become concepts, thoughts, and subjects. And anybody who falls through those cracks all of a sudden has a world that's closed and unintelligible. So our role is to help as educators so that people can learn to read. So we freed up our staff in Children's Services to go out to grab more students for our summer reading program, because students lose the skills that they have if they don't read throughout the summer. And the second area is empowering staff, and we're going to hear a little bit more about some of the ways that we have reached out to additional communities, new communities, in some of the programs that the staff has found. And number three, the third area is our partnerships that we have made out in the community because of this. The next three speakers are going to address those three outcomes to our new service model.
Thank you, Mark. Hi, I'm Susan McCullough. I am the Children's Services Manager for Ventura County Library. Summer reading and kids. You know, we've been doing the summer reading program for years. The Children's Services Group took a good look at our summer reading program, and we set two goals. One, we want every child that participates to succeed, and two, we want every kid in Ventura County to know about our summer reading program. So we went out into the community, and we built partnerships with Barnes & Noble and small businesses in every community that we serve. We strengthened our partnerships with the Boys and Girls Clubs, First Five NFL, and the schools. In fact, we increased our school visits by 30%. Huge success. The number of hours read over the summer was increased by 44%, and this is great, but we're challenging ourselves to do a little bit better this year. We want to increase it by an additional 15%. But you know, summer reading is just part of what we do to help kids read all year long. Reading really begins at birth. And this is where we begin.
We have early literacy-based story times now at branches that didn't have it before, and we offer it out into the community. Can't make it to story time, maybe you have a sick child or life just gets in the way, you can view full-length story times online from our website. Future, we plan to Skype story times from one branch to another, to our webpage, out into the community. Children in libraries, what an unbeatable combination. Sarah?
Good afternoon. My name is Sarah Roberts. I'm the branch manager at Foster Library, and I'm thrilled to be here today. I get the exciting part to talk about our Director's Initiative grants. So these were micro grants that were available to any staff who presented a new idea or program that would benefit the community. And anyone could apply for these, a student worker to the 20-year veteran employee who's always been thinking, why don't we do this? And we said, well, now we're giving you the opportunity. The first one that I'm going to talk about is our makerspace. So what is a makerspace? It's a place where you come together to make. Just as simple as that. You come, you use the library materials, and you create things. So far we've created buttons, logos, art, movies, film. It's wonderful to watch it grow. Currently we have a 3D printer, and we meet every Tuesday, so any one of you can come and make. Tech Fest is the annual celebration to kick off the new group of kids in the Robots in the Library program. This program was created by a student worker to encourage young students to become STEM majors in college. Many local companies helped out at Tech Fest, including GMC, Chevrolet, the County Fire and Sheriff Departments, JPL, and CSUCI. We had 3 pretty cool events at Foster Library. FosterCon is a festival of comic books. Rock and Roll Made in Mexico was a celebration of Hispanic heritage. And we have the currently Heartprint, which is a teen writing group where they have to put away their cell phones and they come together and write. So what's a library without ukuleles? This is our wonderful grant that we received where we have 5 ukuleles available for checkout. Anyone can check them out, try it out. We have a free class every month where you can come and learn the basics of playing a ukulele. And we just added a jam session that meets twice a month. They were in the library last night. There were ukuleles everywhere. There were 40 people there. It was amazing. I was very excited. So these grants show what a great staff can do with just a little bit of money. Because of these grants, staff ideas became reality. An investment in our library changes lives, creating diverse, educated, and compassionate residents of Ventura County.
Good afternoon. I'm Carol Chapman, the program manager for the READ Adult Literacy Program. Community-led development is a commitment from staff at all levels to listen to our communities and respond to their needs. It involves actively fostering new relationships and daring to do things differently. For example, at the Solis Library in El Rio, branch manager Humberto Teo knew that customers wanted to learn to read and speak English. He responded by inviting a Laubach literacy volunteer to teach classes at his branch. Because he was out in the community talking with people, he met staff from the Rio School District and learned that the Mixteco children out in Nyland Acres can't get to the library. They can't get to the library. Unacceptable. So he decided that he was going to start up a small library at the Mixteco Community Center in the Boys and Girls Club. This is just one example of what's happening in our branches all over the system. The READ Adult Literacy Program partners with the county probation and sheriff's agencies because 70% of incarcerated adults are reading below the 6th grade level. And the more education they receive while they're in jail, the less likelihood that they will be rearrested later on. The Veterans Resource Center at Foster Library is a grant-funded collaboration with Calvet. Only 7 of California's 183 library systems provide this service. Oakview's Book to Action participants chose to raise awareness of food insecurity in their community by sponsoring a food drive. Similar projects at the other branches will address ideas specific to each of their communities.
The things that you've heard about today were only possible because every single staff person in our library system agreed to change their job. And that was really scary. Things that people have been doing for years, not knowing if they would have a job in the future, which is very funny. We are the lowest staff library our size in the state of California. We have 30% less staff than any other library our size. We've done all of these things, moved out into the community, connected with school kids in new ways without adding an additional position. We've done it almost all by using technology and by changing the way we do things. In 2008, the management team got together and created a vision statement, which you should be happy I'm not making you read because it's 4 pages long. But part of it said this: we go to where the public is. This is what we thought we would be like in 2013. And it says it requires partnerships, it requires technological solutions, it requires not only that we act outside our comfort zone, it requires us to create new comfort zones. And when we reread this year, we said, wow, that's pretty cool. This is where we've gone. This is what we've done. To continue on, to do this in the future, to keep doing this, and to create more of the kind of things we've been able to do, we need more technology. The first piece of technology we need is we're going to have a new bookmobile this year. Our new foundation is fundraising for a bookmobile, and they assure me that's going to happen. We need technology at every level in order to reach out and to meet people and to do the things that we're doing and to enable our staff to stop doing so many of the things that they've done so that they can do the new and cool things that really connect us with our communities. We need your support. The state is considering adding libraries, public libraries, to the scenic backbone for the schools and universities. The $3 million of that is part of the governor's budget this year. However, the whole project is going to cost over $20 million to connect all public libraries. We not only want that to happen, but we'd like to be first on the list. A few years ago, you folks gave us $100,000 for unincorporated branches. A lot of what you see that happens here happened just because of basic things we were able to do out of that. I know that Supervisor Zaragoza started that, and one of the first things we did was put an HVAC system in El Rio. That seems so basic, and yet what I keep saying to people is on a hot summer day, when a kid who doesn't have air conditioning at home finds out that their local little El Rio branch has air conditioning, they'll come into that library they've never been in before. Their family will come in, and we'll have library users for life. And that's not just a little thing. 20% of the adults in Ventura County read below the 5th grade level. They can't fill out an average job application appropriately. They can't be good employees. They can't be good taxpayers because they're not literate enough. We've challenged Susan, the head of our Children's Services, to put Carol, the head of our Literacy Services, out of a job, to make every kid in Ventura County literate so that Carol doesn't have anything to do. And Carol has agreed to that. I want to thank you for listening to us today. I hope we haven't gone on too long. And if you have any questions, we're happy to answer.
Mr. Chair.
This is a great presentation.
Thank you.
Really, as Supervisor Long said, we haven't heard from the libraries for a while.
We have the
so
best
it's just great
people.
to...
I have the best managers on the face of the planet. They just are. They're the best
It's
people I've
great
ever
to
worked
feel
with.
the energy. It feels really genuine, and it's exactly what we have to do to be able to connect out there. And you talk about one of the things that sort of improves the quality of life. I mean, we need to have good libraries for us to have a county that we're really proud of and stuff. I know Supervisor Zaragoza has something to say, but
I want
thank you
to thank
very
you
much.
too, because I remember several years ago I went over to the El Rio library, and it was hotter than hot in there, and just having the AC there made a lot of difference, because now we have adults going out in the evenings to utilize that library, and the ESL program I think is extremely important for the residents here in El Rio.
I think it is too. Our literacy program teaches 250 adults a year to read, but those are all English language learners. They speak English as their primary language. We have not had an ESL program. We've let other organizations do that. So this is our first presence in a county library, and it's good.
And the other thing I want to commend you on the Nyland Center. Several years ago, the children in Nyland had no place to go at all. They used to play on the streets, and out of vacant lots, and they get in trouble now with the Nyland Center and having the Boys and Girls Club there, and also having the partnership with the library has made a lot of difference for those individuals there at Nyland. And I want to thank the partnership and thank all the presenters for the excellent work that you guys have done.
And I want to point out, we're presenting. It is our line staff who did all those programs up there. They came up with them. We said, here, we'll give you some money. Think of something you want to do. And we were astonished. Yeah. And now what we're hearing is we're having staff come to us and say, I've been doing this, and I've been thinking this is what my job should look like now. It's totally changed who we are and what we're doing.
Yeah.
Just really appreciate the making it more accessible, and of course we love the idea of the bookmobile, but also taking to the Boys and Girls Clubs, the mixed Texo population that can't get to the library has that ability to get to books. How important that is, and even reaching out to the probation, and I just think it's wonderful that you're taking books to them if they can't come to the libraries, and then obviously doing it electronically too, just making it as accessible as possible. So kudos to all the creative ideas.
Thank you. Thank you very much. And we'll be opening a new branch in Sataquoy sometime this summer.
All right.
You'll all be invited.
Supervisor Long?
So thank you. It's great to hear from you all and to hear the enthusiasm and your leadership, Jackie, and trusting your managers to say, let's create this new comfort zone. And now they're so empowered, they want to move it on forward. It's very exciting because you have continued to do all this great work with still the lowest level of revenues and staffing of any library this size or in the system. And that's what we have to continue doing, things like this, so the public gets engaged and feels as both empowered to help us to advance literacy in our county. To still have those statistics is pretty astounding in this county of our affluence and opportunity. So thank you. It's good to hear from everyone.
Mr. Powers?
I would just say that I love that it just defies the stereotype that people must have of a public library, right? Old school, horse and buggy, out of date, and yet what you've created is high-tech, innovative, cutting edge, the latest in technology and access for our community. So hats off to you. I love it. What a great story, and I appreciate the culture that you created that promotes this.
You guys did it all.
I was going to say, this is a whole different presentation than we saw over the last few years. This is a whole different, I mean, it takes a lot to recreate yourself in an organization. I mean, we've talked about before about getting that technology out to the public. A lot of people don't end up in the library, but I can take the resources of the library and have it myself without having to be there. A lot of times I don't have to go there. But all of a sudden, if I do it, wow, why don't I just take the next step and go there too? I mean, this is tremendous. I love what you guys have done IT-wise, but just all the different things. I mean, even down to the ukuleles. I mean, you've got the place, you've got a reason to bring people in. That's really a cool thing. People just come to, it's a fun place to have fun. I don't just go to read. I go to have fun. I get to learn. Isn't that what a library is all about learning? Maybe not out of a book, but and then teaching and doing English. It was really quite a different presentation. Congratulations.
And then just also thinking about your history, how you can now focus on positive things. And I just, it's really where I'm at right now too. You're not fighting dissolution and those kind of things. You can focus on positive things and bringing in new services.
No, and it's been really good for us. That process of having to rethink who we are and how we serve the public has been great. And I do want to say one thing. We're seeing a return of a lot of upper middle class people who could afford to buy their own e-books and who are now discovering that they can use their Kindles in the library through the website, and they don't even have to come in. They don't have to find parking. They don't have to find time. They can just do it. So we're reaching whole new audiences, so we're pretty excited.
Taking technology to what it can be in the library is what it really should be, because it's all about that ability to grab that information, and now we can do it. So it's tremendous. That's great. And maybe these other people are going to go, wow, look what they're doing now, these other libraries.
Jackie, what can you tell us about the Library Foundation? How's that going?
They've had their second meeting now. They're ready to start organizing around fundraising. They have set themselves a goal of their first object is to get a bookmobile up and running. But they seem to think that's going to be really simple. And so they actually ask us to think about other things that we might want money for, which I'm incredibly enthusiastic about. And we've asked them to focus on children's services and literacy for the beginning, and then over time to create an endowment for books. One of the things that we still really struggle with is having a stable budget for books. but it's a great group of really dedicated people. We had a lot of support from Supervisor Parks and Long in finding members. Mike Salachi is our chair, and Marty Robinson is our vice chair. So we've got business community connections and longtime Ventura connections.
And how many people on the board?
We have, I believe, 7 right now, and I might be off on that, Steve, so don't hold me to it.
Great.
Rosemary Allison and Hank Lacayo and Mike Salachi.
Yeah, I could name them all better than I can count them all.
Salachi's a good man.
Typical librarian, better to words than the
Hank
numbers.
Lacayo, Elena Brokow, Lori Flack, and Patty Walker from Fillmore. So we've got a good starting group going forward. Sandy Berg. And they are meeting as a subcommittee on Thursday to start the fundraising plan. And they were very excited to hear that Elizabeth Topping, the county librarian in the 20s, ran the first bookmobile in the state of California, went all the way up to San Luis Obispo with it. And I've tried to convince everybody that there's this great picture of her having shot a mountain lion, and she's draped it over her car as she's off in her bookmobile. But apparently we're not going to have that picture on the side of the bookmobile. But they did want to see the picture.
Mr. Chair.
Yep, Supervisor.
Jack, I want to thank Mark, and I think he's the IT person. And you're ending there, technology. Well, that's the future right there.
You know, one of the things I want to say is that not only is it the future, it's our present. Every single thing we do, and Mark runs a department with 5 people. They serve 11 libraries, 12 buildings, plus our web presence with 5 people. And everything we do runs
Because the
through it.
children nowadays, all they go is to their phones or to the computers, and I think that's the future right there. And I want to thank you, Mark, for your IT services. I think it's extremely important.
Thank you very much. We really hope to be moving into the whole mobile devices in the next year. We've just done our policy, and we are really excited to be lending these things, both for staff, public, and to make our presence even more known than it is now.
It's very important.
Yeah, we're already. You can use the things on your own mobile devices, but we're going to start lending mobile devices.
Okay.
I just wanted to thank Mark. For an IT person, you set the tone there. You've got such enthusiasm for it, so thank you.
Well, to all of you, one, thank you, and would you go back and thank your staff for us? I mean, you're obviously hearing from a board that's genuinely excited about what you're doing, and we certainly want to hear more, and let us know how we can help you. All righty, great.
Thank you very much.
Thank you very much. Bye. Mr. Smith, are we going to be adjourning, or will there be any announcement as we come out of closed session?
There will be no announcements. No announcements.
We still have board comments.
Okay, my comments, no comment. Go next.
I just want to encourage people to join my NAMI walk team. You'd be with the Mighty Oaks, and I'm going to show you what the T-shirts look like. And I know it's a T-shirt contest. I don't want people to use this as their competitive advantage, but we got the Mighty Oaks on the front and an oak tree on the back. We'll do it in your size, and hand-painted shirts. So, and of course, it's for a good cause. National Alliance of Mental Illness, and we're also having a kickoff luncheon on March 14th if you want to be a team captain. So if you don't want to be on my team, then you can start your own team. But I would encourage the board to be on my team. And we've got shirts in all sizes. Did I mention that? Yes.
Great. Supervisor Long.
Okay, well, where'd it go? I have a German memory put forward first. And then I wanted to just talk briefly on the NACO conference that I was attending last week, why I wasn't present here at the board. There was actually it was a good conference, a couple of good things that I picked up, and things that, again, as always, went to workshops that just said that not only are we as a county on the cutting edge of some of these subject matters, we're we are doing a great job. One of the workshops I attended was reducing liability in police lockups and holding cells, and it's the new PREA guidelines that all the law enforcement, those who run correction facilities, must abide by, and it's national guidelines. And speaking with Sheriff Dean, not only is he aware of it, he's implemented it, and the challenge that's coming now is, of course, these guidelines are now being audited, and if you don't pass your audit, you're subject to sanctions. So it was good information forward to the sheriff, and as I said, he's already noted that he's very aware of it and on top of it, and is assured that he can pass any audit that comes his way. The other one that I found, a lot of focus, of course, on the Affordable Care Act, quite a few workshops on that. This particular one I attended, they referred to it as the Cadillac tax, and it's the excise tax on high-cost employer-sponsored health coverage. Again, was on your agenda last week that Kelly Shirk brought that forward and addressed part of this, and certainly looking to make sure that we are, as the employer, that certainly our own program meets, more than meets what is needed, but also we don't fall at any level where we'd be subject to this excise tax for performance. The other thing that was, there was a complete platform that NACO had, and most of the things we're already working on related to transportation infrastructure needs, MAP 21, and there was quite a rally around that at NACO that had good participation, so it's a across-the-board need by all states and counties in the nation. We heard from the Secretary of the U.S. Department of Housing and Urban Development, Secretary Sean Donovan, and he talked about the home program leveraging more, $4 for every dollar invested leverages homes to help folks in our communities. We know that that's been a successful program, and always would like to have continued support on that from HUD. The other ones I've touched on. The last thing, well, second to last thing, the NACO's launched a coin, a county innovation connection on their website, and I'll pass this on to Mike Pettit, and also for us to look at, but it's a peer-to-peer knowledge sharing and collaboration nationally. So you could go on to NACO's website, you can look at, for example, what is some other county doing, and I expect most of us would be looking at California counties because we are unique, but what are other counties doing in the areas of prison reform, realignment, infrastructure dollars, and so it's a portal that you can not only go in there and look to see what others are doing, but we can put in some of our creative programs that we're doing to share that and to learn from one another, solutions that have been developed by other members, and so it was a catchy way of doing it. So that, but I must say one of the most exciting things I did while I was back there, besides truck through the snow, was to go see our congressional women, as in Lois Capps, who has a little bit of our county still, but also Julia Brownlee. I'm very excited that the timing and visiting with the Congresswoman was that she was able to announce the $12 million for Channel Islands harbor dredging. And I, as always, as we know, often the work we do, what's on the headline doesn't tell the whole story as to what went on behind all the work that was done to get these dollars into the President's budget, into the Army Corps work plan, and to be able to have the firm commitment that by October of this year, we will be back to full dredging, and that, of course, helps the city of Port Hueneme replenishing the beach, certainly helps our harbor, and then all the downstream that comes from that level of pledging. And there was clearly interest by both of the Congresswomen to work on what is a more sustainable model, that we're not going through this cyclical, always looking for dollars for dredging, particularly in ports that have both the economic value for us for the recreational and tourism, but in our use too, that it's a so connected up and down the coast with and impacts to the city and their tourism and visitors. And so looking at what's a more sustainable model for the Army Corps of Engineers to work with these small harbor ports to get us off of this cycle of scrambling for dollars and dredging. So that is that. Thank you.
Thank you. Thank you for attending NACO on our behalf and keeping us up to speed like you do in Sacramento also. So appreciate the update and appreciate the efforts in terms of going there. I'm going to keep my comments very brief. I want to just try to focus on adjourn in memory of the people on this list, but I'd like to ask the board to adjourn in memory of the Los Angeles police officer that we saw that died in the accident with the trash truck and tipping over. But that's Nicholas Lee, 16-year officer, father of 2 daughters, and just always tough to lose a public safety person in a situation like that. I look forward to, I attended, County Superintendent of Schools had great 20th annual conference, and one of the sessions on trying to make our teenagers more literate, more educated about all the sexual challenges that they face out there. Really excellent presentation. And want to do something. It's a girls empowerment program, and it's just really a great program. And so at some point in time, I will bring it into the board and ask for us to consider everything we can do to try to help that program go countywide. And with that, Mr. Powers, you have anything that you want to add? All right, here we go. We're going to go to closed session. There will be no announcement when we go out. Oh, correspondence agenda. We need to vote on the correspondence agenda. That's right. There we go. Let's vote on that. And now we'll go to closed session and adjourn from that. Did I hand you? Oh, yeah, I got it. Cruz. Super.